All righty, baby. All righty, we're live. Okay, so here's what's going to happen. I'm going to explain to you about a 9-month healing process on my foot that should have taken 8 to 10 weeks. And the healing process was set back by 6.5 or 7 months by the incompetency of doctors and hospitals and test results. That I took the tests religiously when they asked me to take the tests to see what was the reason that my foot wasn't healing. And yet, when I would ask them what the results were, they would say the results were not, would not confirm any single problematic aspect, a bacteria or a bacterium, or a medical diagnose. There were theories, nothing but theories. We're talking about five doctors in 3 hospitals that pretend to be doctors in 3 different hospitals. We are talking about the most incompetent doctors and or diagnoses that I have ever heard of in my life, because it happened to me. Although when my dad was sick, there were doctors that have theoretical things that they want to test you for, and they test you in America. They test you for things that cost $10,000, $15,000, $20,000 a test, and then they don't come to a result. So I won't say that it's just here in the Philippines, but I will say in my case, it is the most disgusting of all the things that I have been in the Philippines. The doctors and dentists, because we're going to talk about 4 different dentists as well as the 5 different doctors. The most disgusting and worthless and incompetent and straight up and down fraud committed to not just myself, but people in general. Okay, and I'm not going to let this go, because those doctors diagnosed me wrong. 5 doctors diagnosed me wrong for 7 months. 7 months. They were giving me the wrong medicines. They were giving me the wrong diagnosis. They were giving me the wrong instructions. They were giving me wrong advice. They were giving me advice that goes contrary to the advice on the medicines themselves in those little small papers that you read. They were giving me advice based on nothing. They were just, and what it appears to be that they were doing was prolonging the injury on my foot so that it would never heal. That's not just an opinion. If it happens 5 times from 5 doctors in 3 different hospitals, and all of their diagnoses and all of the medications that they give you are similar, then there is something seriously wrong with the healthcare process in the Philippines. They kept me off my feet, out of work, and in pain for 7 months, when in fact, had any one of them been intelligent as just one American doctor named Clark, if any one of them had 1/10 the knowledge of this gentleman Clark who helped me — I won't mention his last name because he's the head of a hospital in America — if any one of them gave me the advice that Clark gave me, and that Daisy May gave me, and that Daisy May's mother gave me, if any one of them had agreed with Clark, Daisy, and her mother, my foot would have healed up in 2 months. But no, they prolonged it. And I have a personal belief that they did it on purpose. In other words, let's see how long we can make this stupid American come back and forth to the hospital, and let's bleed this guy dry for monies, because that's basically what they were doing. Okay, every time I walked into the hospital, it was 1,500 pesos. Every test was 1,700 or 1,400 pesos. Every time I had to go take a full panel was 2,000 plus pesos. And I did that several times. And nothing did they ever find out. They never found the bacteria. They never found the bacterium. They never found that I had diabetes because I didn't have diabetes. They never found that there was some sort of uh, like a flesh-eating bacteria. Nothing. No, nothing like that. They never found anything. They kept doing blood tests every 3 to 5 weeks. They do a blood test, and they would tell me all my cell counts and all that stuff were good. Twice they did a full panel workup where you don't eat for 10 or 12 hours prior to going to the hospital and get your blood work. They found nothing ever. One time, the first time they did the full panel, I think the borderline for diabetes is 180, and I think I had a 177 count, which was where they start to believe that you might have diabetes. And then the second time it went down into the low 160s, and there was a good reason for that. The pain that I had when I first went to the hospital, I didn't start reading the comments yet. The pain that I had when I first went to the hospital was so intense, I had no painkillers for, it was a holiday weekend, and I what I did was I just drank a half a quart of rum the day before I went for the test because I was in so much pain. So that's why the blood sugar was so high. It was like 177. Okay. So but I am going to tell you a story, and I have it all written down right here. I made notes. I'm going to tell you about the most incompetent doctors. I can't say their names, but I can tell you which hospitals they worked in, and I'm going to do that. And I'm going to talk to you about incompetency when it comes to dentistry in the Philippines as well. Because I had the same cavity replaced 3 times in 5 weeks. 3 times in 5 weeks, I had a cavity replaced before the last dentist put it in, and it's still in place. And each time they said, no, that it won't fall out. And at one time it lasted 3 days. The next time it lasted about 7 to 10 days. The time after that, it lasted 3 weeks until finally I got a dentist that fixed it, and he wasn't any better than the first 3. I basically told him how to do it. So I'm going to go to the I'm going through these notes. I'm going to tell you about healthcare in the Philippines. I'm going to just bottom line healthcare in the Philippines. It sucks. It totally sucks based on my experience and 7 months of bullshit and bullshit exams and tests and blood tests and full panel exam. 7 months. And what eventually healed my foot was not taking any medication at all. Nothing. Zero. No pain pills, no medication, no cream, nothing. That's what healed my foot. All their medications and all their creams, and there were many, all of that shit placed on my foot, what they like to call slathering it on. Slather on this medication. Just take this medication and put it on an eighth or a quarter of an inch. Sure, at 400 pesos for a small little tube like this, slather it on. It'll last this little piece of garbage tube of medicine in the hospital was 400 pesos. Go across the street to the pharmacy, it's 185 pesos. Sure, just slather it on. Don't worry about it. When you only really need to cover it, they have nothing. They do not, in my opinion, have your best interests in mind. And I think, personally, they were intentionally prolonging my agony so that they could get me to come back to the hospital every week to 10 days to look at my foot, debride it, and then tell me to put more of this crap on it at 400 pesos a tube, even though after about 4 or 5 weeks, I started buying it at the at the Rose Pharmacy, okay, which was $185. So it was twice the price in the hospital for the same tube, the same amount of grams. And then we came to doctor number. That was at Romero Hospital. That was doctor number 4. Tells me to use, honey, he tells me to use this garbage, Flamacerium cream. I don't know if you're going to be able to see it. This is called Flamacerium, which is a mixture of this garbage here in this tube and something else. Silver sulfadiazine, this garbage, okay, and it has Flamacerium and a different kind of Flamacerium cream. It's a mixture of 2 chemicals, and then the son of a gun doctor in the 2nd hospital, the 4th doctor, starts selling me this shit in a tube, in a cup, the kind of cup you'd get like grating cheese in at a pizzeria, some small little cup like this. Started selling me. He told me that I could only use the stuff from his hospital, and that you would go to the pharmacy, and here's the deal. What another scam this Romeo Hospital is. You can only use this cream from their hospital because it's a special blend, right? Okay. Bullshit. Total bullshit. Okay. Now, it comes in a container about this big, and this was about a little bit more than 3/4 full. This is not the container, but this is about the size of the container. And it's 650 pesos or $13 for 50 grams. Okay. And you can only use theirs. And then I said, let me see what it looks like. The doctor gave me the name. This is a total fraud being laid down on you by the Philippines healthcare. It's not, well, if it was one doctor, it would be a mistake. But if it's 5 doctors, three different hospitals from 5 doctors, and they all say the same damn thing, then they're either all stupid, which could quite possibly be the case. They could all be stupid because they all gave me the same stupid advice, or they could be in cohorts with one another, or they could just be trained improperly and giving you advice that they think is legitimate advice. But in the meantime, my freaking foot had a wound on it, 2 3/8 of an inch wide, and it was raw meat for 7 months. And I'm going to tell you the stories that each doctor went along with and what they told me. I didn't even start to tell you about the stories from the doctors yet. I didn't even start to tell you about the first doctor, what the first doctor said, what the second doctor. I didn't even tell you about the doctor who I called the most incompetent son of a bitch that I've ever met in my entire life. And he said to me, "Get the F out of my office." And I said, "Fine, how much do I owe you?" And he said, "Nothing, just get the F out," because he accused me of doctor shopping because I wanted my foot fixed after 7 months. And I told him his friend was an idiot, and he blew up like you wouldn't believe. Like, you're not supposed to say a doctor is an idiot. This guy lied to me for 3 weeks. I went back to his office, and for 3 weeks he told me the same bullshit story. I took a full panel. I took blood work twice, and he kept telling me to put more of this Flamacerium cream on. Just put it on a half-inch stick. Just throw it on there, half-inch stick. Do you really think I'm going to believe that you should put this shit on a half-inch stick? A half-inch stick would not only block out, he's saying it'll block out any bacteria, it'll block out the sun, it'll block out a nuclear holocaust, a half-inch of this shit. And at $13 for 2 ounces, what does he give a shit how much of this Flamacerium cream I put on my feet? They didn't give a shit about that. He gave a shit about selling this stuff because he thought I was buying it from the hospital for $13 a cup. Now I'm going to read the comments. You think I'm animated about this? I am so pissed off that how much money I spent on doctor care and got no doctor care, nothing. The only doctor care I got was day one when the infection was in 3 places on my foot. They took a scalpel and they scalpeled off the raw meat to a 2 3/8 inch hole on my foot, which I won't show you because YouTube, I have pictures of it. YouTube will call it, they had the name for it. That I did post one of those up, something that had to do with, it's disgusting. It's an open bleeding wound down to the meat, bleeding with, pustules and stuff like that. It is disgusting. So YouTube will pretty much ban the video anywhere I post it. But that's what it was. It was an open 2 3/8 inch cut in the skin. They took the skin out, and then the son of a bitches, every one of them, they want to debride it with a little toothbrush with no painkiller. Okay, they take great pride in giving people extreme pain. And I think they're a bunch of sadist bastards is what I think, because not once did they offer me a local anesthetic, and each time they scraped the raw meat with like a little brush or a swab, and each time I didn't cry, but tears came out of my eyes. It was real. It's raw meat, and they got a chemical, whatever chemical they were using, and they're swabbing the raw meat with like a very fine brush, like a toothbrush, and on the end of the toothbrush is a little piece of like a little rag, the stuff like a gauze pad with the chemical on it, and they're scraping off right down to the meat each time. So every time it healed a little bit, the next week or 10 days later, they would debride it. They call it debride. We're going to debride your foot, and they charge you to debride your foot and to put you through that pain when it was never necessary. It was only necessary the first time. So let me read the comments and see what's going on. Son of a, this place is a joke. The Philippines is a joke when it comes. I didn't even talk about the dentist yet. I might have to go for another whole show about dentists, because they suck as much as the doctors. Hello, Pennsylvania Trucker. Gilda Ruby Jennison. I see you all over the place. Hello, Gilda. You're new. I wonder who you are, actually. Mercury, good morning. Yeah, Gilda, you're about fucking history, okay? Yep, you're history, bitch. I don't know who you are. I see you commenting on... I don't know who you're talking to. Either be clear as to who you're saying needs a head doctor, or get the fuck out of here, okay? Be clear on your accusations. You have like 10 seconds to correct all of that shit. Hello, Popeye. Popeye, I was on your live stream. I caught you saying goodbye. I heard someone mentioned that my foot hasn't healed up yet, which is not the case. My foot is 100% healed up. And then your live stream went down. And by the time I had to refresh the page twice, and by the time I refreshed the page twice, you were ending the live stream. So hello, Popeye. Thanks for stopping by. That Blue Rose, you have no idea. I didn't even start to tell you the stories that the doctor... I'm going to go through each bullshit story that each of the... Well, the last doctor, he mother effed me. He mother effed me at the top of his lungs in his office for calling his associate a fraud and a worthless physician. He literally stood up and towered over me. He was a big dude. He was over 6'2", over 230, 240 pounds. Huge man, a huge Filipino man. He towered over me, stood down and shouted down at me. Then I stood up and I stuck my hand in, not my finger, because that's not a good thing to do. And I told him, go F yourself. How much do I owe you? How much do I owe you? You talk to me like that. You're supposed to be a doctor. This guy he went nuts. He went insane when I called his friend a worthless fraud. And I'll tell you, that was the worthless fraud that said just slather it on a half-inch thick. What am I? Do I really look stupid? When you want to stop the oxygen or atmosphere from hitting a car, do you really think you need a half-inch of cream to do that? Maybe this shit is 3,500 pesos for this container, but when you buy it by the little cup that they were selling it in, this would come out to about 14,000 pesos. 500 grams divided by 50, 10, excuse me, not, yeah, 500, yeah, figure 50 grams, 500, so it was 10 times 13 or $130. This would be 7,000 pesos in those little cups if they gave you 50 grams. And so, and that's how they wanted you to buy it. So instead, I paid 3,500 pesos for the whole container. So they doubled the price, and I don't think I was getting 50 grams. Why would I know what 50 grams is? It just didn't seem like 50 grams in weight. And I got a pretty good feel from working with aircraft nuts and bolts. Okay, so okay. Hello, Spanky. Hello. Good morning. Yes, I do also, Spanky. Yeah, I have. I'm renegotiating a longer contract right now for that. I don't like the contract that I had, and I'm renegotiating it. I'm going to give them more money, but I want to have a longer contract. Um, Dennis Adams. Good morning, Dennis Adams. Yeah, they suck, these doctors here. I can unequivocally say that I went to 5 doctors that sucked. That not bad doctors, perfectly straight up and down sucked at their job. Okay, the reason is because on when Clark, um, who gave me a diagnosis at around the 4th doctor, he actually he told me what to do, and I did it. I soaked my foot in the guava leaves. Now, Clark is an American doctor who's coming to the Philippines, and we're going to meet, but he also understands Philippines remedy, and Daisy's mother said put the guava leaves on. So Clark agreed to put my foot in steeping hot water, as hot as I could get it, and let it soak for 30 minutes. That would cleanse the wound. But Clark also said, you can use that cream, but for 10 days. After that, the cream prevents your foot from healing because it's actually burning up the cells that, in other words, it's like putting an acid on it. It kills the germs, but it keeps it from healing. That was what all of these 5 morons, these 5 sadistic bastard doctors in the Philippines, that was what they all wanted me to do. Put people slathering it up. One guy would tell you the stupidity of it all. I'll tell you about that in a minute. Let me read some comments. Blue Rose says the only thing those Philippines doctors are professionals at are being professional liars and scumbags. I'm agreeing with Blue Rose straight up and down. I'm agreeing with them because then how could 5 people diagnose you wrong? How could 5 people, and they didn't even confer with one another? They didn't know the previous doctor. I didn't go there and tell the doctor. I went there and showed him my foot, and I told them what the previous doctor's name was and what the previous doctor said to do, and then, but they didn't call the doctor up in the meantime and find out that they were doing it. They all had the same shit, worthless advice. That's what went on. Okay, so Pinoy Ahoy, hello, welcome, Pinoy. Let me try to get through. I don't think any of the doctors' names were Frank, but they all sucked. I didn't have gangrene. Expat Pepper, I didn't have gangrene. I had a bacteria, I had an infection under the skin, but it was not gangrene. It just was some sort of, it was similar to a staph infection from whatever I could. And all the tests, the full panel tests and the full blood workups that I did within the first day I went to the hospital, the next day they told me don't eat and have the full panel test. Not one test result gave any indication of anything that it was. They didn't find bacteria for a staph infection. There was no gangrene. They didn't find, in the blood work, they didn't find any high or low blood cell counts. They didn't find any of all the other things that they test in the full blood workup. They found nothing. One thing was a little high, and if they pointed it out, they all had to make up. The two morons I showed the test to, the first moron that told me to take the test, and the second guy said, you should be a little concerned about this. I said, what is it? Well, he gave me what it was. Had nothing to do with the bacteria. Had to do with something else. And I'm going, well, I need to figure out how to get my foot fixed. Let's work on the foot first. Do I have diabetes? No. Close. But I told you, I drank a half a quart of rum. You had to be at the test in the morning. I had to be there at 8 o'clock to take my full panel test. And he said, don't drink or eat anything for 12 hours before. And I drank a half a quart of rum to kill the pain from the foot. After they debrided it and cleaned it, I drank a half a quart of rum in order, because they gave me a pain medication that I took 2 of those pills and it did nothing. It seemed like it did nothing, but the half a quart of rum, that solved the pain issue and I could go to sleep, because that was the night I got home from the hospital. Barely could walk. Okay, so it wasn't gangrene, and I'm not upset that you say that, but please get that out of your brain, because gangrene is something else. Oh no, it can't hurt that bad having raw meat. Expat Prepper. Expat Prepper. It was a raw, open wound down to the flesh, 2 3/8 of an inch, that the raw open meat was on the top of your foot where it's very sensitive. You don't think it would hurt enough to make tears come to your eyes? Then you're a fucking idiot. Okay? Plain and simple, you're a fucking idiot. Have you ever had raw open meat, 2 3/8 of an inch on the top of your foot? Open, raw open meat, and then somebody scratch it with a toothbrush? And if you don't think it could hurt bad enough to make tears come to your eyes, then you're just straight up and down a fucking idiot. Because it wasn't your foot. You don't know what it would feel like. And maybe you did. But maybe they gave you morphine so you wouldn't feel it. They gave me no pain medication while they were scratching and debriding my foot. So, any more of that horse shit from you, and you're gone. Okay, I don't really give a fuck whether you like me, like my channel, like what I have to say. That's how much it fucking hurt. It would bring tears to your eyes while they're debriding it without any pain medication. You don't get that? Not my fucking problem. Flying circuits, it's all in draining people's pocket. Okay, Grandala, I don't know what that means. They took every test that you could take, and they came up with not, okay, I did a full panel workup twice. A full panel workup twice. Nothing. No bacteria. Nothing, or they didn't tell me that there was a bacteria. I did blood tests, I did 3 times. And nothing did they tell me. Nothing. There was no results, nothing from blood tests. Now, Where expat prepper said it was gangrene, well, then I would think that they would know what gangrene was. I would think that they would know what gangrene was. I could be fucking wrong. I could be wrong. Maybe they've never seen gang, but I think they know what gangrene is. Okay, it wasn't. They didn't tell me that's what it was. Okay, Pinoy Ahoy. Uh, I have a news flash for you. That's well, the Pinoy Ahoy. How about warm water and Epsom salt? You can't buy Epsom salt here. When I was looking for Epsom salt, I did look for it. They didn't know what it was, and they didn't have it, and they couldn't order it. Here's the thing about the Philippines: if they don't have it on their shelf, they won't order it for you. If they tell you it's out of stock and you ask them to order it special, they won't order it for you. They'll just tell you come back tomorrow or come back next week. And you come back next week and they say not in yet, so come back next week. So I looked for Epsom salt, but to replace the Epsom salt concept, Daisy's mother, her grandmother, a woman I met on the jeepney, and a man that didn't know her all said guava leaves. And we have a guava leaf tree right next door. So they said, and Clark Henderson, Clark said also guava leaves. Okay. And I did the guava leaf thing, and it felt better. But that was while I was doing the guava leaves, I was still going to the fourth surgeon doctor in the hospital. And all of these guys are emergency doctors. They're doctors and emergency. All of them have a separate doctor room in the hospital, and they all do um, emergency walk-ins. You know, they rotate. You know, where one guy is doing emergency room procedures one week, and the next guy's, or the one guy's doing emergency room procedures for like 3 hours a day. So I looked for Epsom salt, and they didn't have any. And this is going back in sometime in December, January. They didn't have it. They didn't know what it was, and they wouldn't order it for you. And that's, we're talking drugstores, we're talking supermarket, medical, you know, where they sell medicines in the supermarket, no, and the hospital. No one would had Epsom salt. No one knew where it was. No one would order it for you. So that's a good thing. My father always soaked his wounds in Epsom salt, but they don't have it. Just like they don't have. You want to hear something? They don't have two things for mechanics in the Philippines. They do not have starting fluid. They do not have it. They do not know what it is. If you ask them for it when you go into the biggest automotive store in Tagbilaran or Cebu, they will not know what starting fluid is. They will tell you, oh, you would like to start a diesel engine? Use brake fluid. Two different products. The reason that you use starting fluid is because it has a low flash point. Brake fluid has a much higher flash point. Plus, it's better for the motor. But if you're trying to start a motor that's just not going to start, you want to use starting fluid. If it's a really cold day, brake fluid's not going to help you that much as starting fluid. They don't have starting fluid. They won't order it. They've never heard of it. They don't know what it is. You write it down on a piece of paper. They won't look at the computer. They don't know what, they will not do it. And they don't have Loctite in any store in Tagbilaran. And I went to every single store in Tagbilaran. What they tell you to use is nail polish remover. Nail polish. They tell you to put nail polish on the bolts when you put them in, which helps. It causes a gummy substance to dry up inside on the threads, but they don't have Epsom salts, they don't have starting fluid, and they don't have Loctite. Okay. Yeah, you like that where I licked the camera on the jet ski. It's tough having fun out on the ocean. That salt water builds up on the lens. That's a good catch. Yeah, Popeye, it is time for another haircut. I'm thinking I could get 250, 300 because it's short. And I'll think what I'm going to do is I'm going to have Daisy just pull out. And I don't know if I'll go for a full haircut. I'll just tell her to pull out the salt, leave the pepper. Johnny Adler. Yeah, my Dr. Joe was a great doctor. He could fix anything. The old doctors are, they had to, because they had to know everything. I'll go back. I'm going to start telling stories about George, if you're still there, all that stuff. George, send me your telephone number on Facebook again, okay? I lost my Skype because I gave somebody in New York my credit card. I gave somebody in Cebu my credit card back in January, and I had to have it replaced when I picked up the new card when I went to New York. But what happened was my Skype account was canceled because the new credit card wouldn't allow a charge from a previous purveyor on there. So leave me your telephone number, George, if you're still out there. Randall, you would think that. You would think that. And they thought it was serious enough that if the next day it didn't look better, now they did the cultural gram test. They gave me no information from all the testing that I did. Nothing. Okay? It's just that simple. They gave me jack shit as far as factual information. Okay. I missed some of the comments. All right, I'm going down here. Okay, I'm at George Parente. George, yeah, I got all that stuff is yours, George. Libre, free. Thanks for the change. So George is the guy when I went to New York. I'm not going to talk about that. But anyway, George, everything I got there, you could take if the other guy didn't take the statues of Poseidon, you can have those statues too if you're still there. Randall, you would think I would have been on an IV drip. These people were just going to bleed me fucking dry. They were going to bleed me fucking dry. They were not interested in getting me better. Okay, it's just that simple. I think they made that determination on day one. Yummy mango. That might be true. Only the phony, worthless doctors stay in the Philippines. That might very well be true. Warren H., good morning. Thank you for stopping by. Okay, Beth Carr. Randall, our problem with medical care, they want to string you along and use the least amount of treatment possible. See, then that coincides with your first statement that they didn't put me on an IV drip. Because let me tell you what I did when the day I went to the hospital, Randall. Okay, my foot was infected. You could feel it, felt like it was bubbling under the skin. And all that happened in 5 days. It got infected, it got worse. Someone said a staph infection is going to get worse and then it's going to get better. But after 5 days, it didn't get better. I went into the water. I went into the ocean with it. They said soak it in ocean water. It didn't get better. So I went into the hospital with my bag, my overnight bag, and enough money to pay the bills for a couple of days. And they didn't want me to stay in the hospital and get an IV drip. I said, if you want, I'll go right into the hospital right now. You put me on it. No, sir. You could be a walk-in. They were just going to bleed me dry, these son of a bitches. And I'm telling you, calling them son of a bitches. That's what, and I'm going to give you the names of the hospitals too. Okay. Thanks, Scott. Okay. I'm here, fat man, George Parente. George. My friend George. You'd have to know. George and I could tell you stories about each other, but we won't. Okay? We'll just keep that shit to ourselves. Oh boy. Oh God. It's funny when you have somebody that knows you since you're a little boy. Okay. Yeah. Loose lips, Michael. I would never tell any of our stories, George. Never. Just understand that George and I have been friends for a very, very long time. Beth called portly is a nice way of saying fluffy. Thanks, Beth. Stories are my favorite. Okay, so now so stories is Beth's car's favorite. Let's get to the first doctor. Let's get the fucking story that the first piece of shit professional doctor in the Philippines that I went to. Here's the first fucking story is I walk in, I got my bag, my overnight bag, toothbrush, some cash. I tell them I'm willing to stay here and go on an IV drip because I realized it was serious. Okay. And it was a holiday weekend and it was freaking hot when I first went in. I don't remember what day it was. It was holiday weekend. It was July 4th. That's when it was. Because I remember I said, I had sent Daisy to Davao to see her mother for a month, which I send her twice a year. I send her to see her mother. And this year, she's actually, her mother came here for 6 weeks. And then, anyway, it was July 4th weekend. And not that it mattered in the Philippines, but I was talking to a bunch of people that were off, from friends of mine on Facebook and friends of mine on Patreon, and making phone calls for July 4th, just chatting with some old friends, childhood friends. So I went to the hospital on the Monday after July 4th, or whatever day it was after July 4th. And the doctor tells me, we're going to have to cut that skin off. I said, okay. Are you going to give me a local anesthetic? No, sir. Why not? Not necessary. It's not necessary for you, but, do you have anything that you could give me for pain, like a local, like, what did the Novocaine? No, sir. Why not? Well, we don't know if you're allergic to it. Good answer, but I'm not allergic to it. You can give it to me. No, sir. Okay, so they cut it open. They gave me some gauze on a stick, and I just chewed down on the stick. And the tears were just rolling out of my eyes. They're cutting the skin, a 2 3/8 circle in one place, a 1/2 inch to 5/8 circle in another place, and a smaller circle in another place. They're cutting it with a razor blade, and then they put in they had a tray of chemicals. This was not the doctor. The doctor told the nurses what to do. And the nurses did exactly what the doctor did not perform any cutting. The doctor stood next to the nurse and spoke with them in their language to where to cut. And then if they want, in one time they needed to cut a little bit more, and they cut a little bit more with the scalpel. Okay, so the doctor did not actually, the doctor never even touched my foot. Like, he never even went like this on my foot. He just looked at it. He didn't need to touch it. He knew there was a problem, knew what the problem was. So the girls cut, and then he stood there and told them of the tray of, they came with it it was like a tool tray that you put pliers and wrenches and stuff in, and they had all these different chemicals, and he told them which chemical to put on, and then told them to what they call debriding it. We're going to debride it now. Yeah, that looks like it's going to be fun. After they threw the skin out. I have a video of that, by the way. I have a video of that first surgical procedure that they performed, but I can't put it on YouTube because abusive content. Not abusive, just, disgusting. It is a disgusting video. I put it up on my Patreon account. Anyway, hello, Slim Jim. They cut this. They cut it into 3 places, and okay. Okay, Beth. All right. Okay, Beth. I'm overweight. Okay, Beth. I knock off the bullshit. Okay, because Frank's here, right? Okay, knock off the bullshit. I would imagine that you're Frank at this point. So let's keep an eye on Beth and shit can Beth if she keeps it up. Okay. Because actually Beth gave Warren H. a backhanded compliment, a left-handed compliment before that. You're a handsome bastard, and Warren took the comment off, which I saw when I was reading down there. So I think maybe Beth Carr is about to get shit canned. Okay. Yeah, you're not Frank. Who are you? You got no name. What's on your channel? If I go to your channel, nothing. Just bullshit. You're just slowing me down. Slow me down again, and I'll fucking block you. Okay? Slim Jim, Gravity Challenge. Yeah. Actually, the reason I'm pretty fluffy is because of these fucking doctors, these worthless fucking doctors in the Philippines. I sat in a chair sitting here for 7 months doing live streams. Actually, it's not even. Actually, it's the doctor's fault that I gained 35 pounds. Well, it's my fault that I gained 35 pounds. I could have not eaten. But when you sit in a chair forever for 7 months, uh, it's hard to lose weight. It's hard to even maintain weight. Anyway, okay, see, Beth Carr was hidden by thank you very much, Blue Rose. There was a lot of bullshit there. Too much bullshit. So here's the story from the first doctor. So after the 4th of July, put the air on. After the 4th of July, the doctor gives me, they do the cuts, and they put the cream on it, and they put the cream on it, and I was on the bed that they did the surgical procedure on. Then the doctor gave me instructions that he wanted me to get a full pound, which I did. Okay, but you can't have the full pound because you have to stop eating for 10. Well, actually, one place says 10 hours. You have to stop eating 10 hours before the test, and one said 12. So I went to 12 hours. But the medicine that he gave me, I think he gave me 2 pills, okay, pain pills. And they may have been strong, but they weren't strong enough to kill the pain. And I used one after they cut. I think it was, I forgot the name of it. It wasn't a very strong pill. And then I used one at night before I wanted to go to sleep. And that's why I drank the half a quart of rum, because the pain pill didn't do it. And I wanted to get some sleep. So, which is why my blood sugar was 177. Okay, so I take the test the next day, and the results came back with no definitive reason for the bacteria, no definitive reason for the infection, nothing. There was nothing in the blood work that the doctor said to me caused this infection, nothing at all. Okay, all right. So that was the office visit. Here's what I spent for the first doctor, and here's his fucking worthless fucking story. Okay, they did cut, they did clean. I saw the raw meat, and it hurt like a bastard. They did put a dressing on it. Yeah, this is another fucking worthless fucking aspect of the hospitals in the Philippines. Okay. They couldn't even fucking dress a wound, these 2 nurses. They didn't know how to fucking dress a wound. I am telling you that these 2 fucking incompetent nurses that did the cutting and did the cleaning couldn't dress the wound, and I told them the wound dressing won't hold. I had a pair of sandals on, so they dressed it, and I'm going, they put 2 wraps. I'll show you what they put on. I don't have that. Okay. Now, let's just pretend. I'll show you the shit they put on there, if I can find it. Yeah, I got it right here. Okay. Another thing they jam it up your ass here for. Buy this fucking garbage. What's in this box is pure, unadulterated, sanitized, worthless fucking garbage when it comes to dressing a wound on a foot. And it is also $12 a roll. It's called it's a kind of stretchy bandage. It's a kind of stretchy bandage that has a little sticky on it, and you pull it over the wound. Now, if it was on your wrist, like when you give blood, and they put a cotton ball here, and they put this stuff on, it's that stuff. It's either red or green or blue, whatever color it is. This is the shit. Okay, but everybody knows as soon as you start bending your arm, it turns into like a wad, and then in a few hours of moving your arm around, you take it off because it doesn't stay there. Now, if you had it on your wrist like this, it would stay there because your wrist doesn't, and no flexibility on your wrist. But this worthless shit is the shit she put on my foot. Here's another. They fuck you with the fucking medicine too. They fuck you at the hospital. This is at the Borja Family Hospital. Okay, I'm going to mention the name of the fucking hospital. Then I hope they fucking see the video too. Okay, these worthless motherfuckers, not only do they fuck you by telling you to take blood tests and then tell you that nothing in the blood test shows back that you had a bacteria or an infection. Nothing in the blood test, nothing in the full panel. They put this shit on your foot, but before they put this shit on your foot, they put this shit on your foot. This shit. Oh, man. I got shit everywhere. I got sticky shit. They put, hold on. They put this fucking garbage on your foot. Now, this one is 175 pesos. It's silver sulfadiazine. This is at Rose Pharmacy. This tube, 175 pesos. At Borja Family Hospital, they charge you 400 pesos. Huh. Okay, you're at the hospital. You're in the emergency room. They take this fucking tube. I swear to God, this is what they did, and I had a fight with them. I went back. I said, give me that fucking tube of medicine. Because when I looked at the bill, I paid for the tube of medicine. The motherfuckers at the Borja Family Hospital, the girl put the medicine, the cream, the flamicerium cream, the silver sulfadiazine cream on the wound. And then she put a piece of gauze, doubled up a piece of gauze over it. And then they put this worthless fucking garbage. Where'd it go? This worthless garbage over the gauze. And I said to the girl, it went around, I'll show you, it went around my foot. But my foot, I have my foot in a sandal, so I can show you my foot. It's all 100% healed up now. But that bandage went around the flat part of my foot and over the top. Okay, it went around the flat part and over the top where the wound was. Okay, and the wound was up on top there, which is gone now, the wound. Okay, you just see a little white skin. That's a little bit what's left over of it. The scar tissue is finally going away. So basically, that white part that you see was raw meat. So expat prepper, let's say you cut 2 3/8 of an inch of skin down to raw meat to where it almost touched the bone. And let's see somebody run a fucking toothbrush across the top of your fucking foot. And let's see if tears come out of your eyes. Okay, so they put this worthless shit around my foot, 3 wraps. Just around, not through the toes and back around the ankle, like you'd lasso something up, or just like what they call a spider tie something, like you spider tie down a load on a truck. I said, you're going to have to put that across the front of my foot and back around the heel of my foot, the arch of my foot. No, sir. I said, what do you mean, no, sir? She goes, this will hold. I'm going, it won't last from the Borja Family Hospital. It won't last till I get to the BQ to buy a roll of this. I wasn't going to buy a roll of this shit anyway, because she said to me, you'll need this. And I said to her, how much is that? She goes, well, we don't have any, but it's $12 a roll. I said, well, I'll just use box tape, regular brown box tape. What the fuck difference does it make? You're putting cream on it that blocks the wound from the atmosphere, and then you're putting gauze on top of the cream, and then the box tape. What is something in box tape that is some kind of magic poison or anything like that? Nothing. You put a couple layers of gauze, the box tape doesn't interfere. But the little bit of glue that's in box tape ain't going to make your foot infected. It's certainly not going to go through all the medicine that she put on it. Anyway, the worthless bitch, I told the woman it won't last to get to the BQ Mall. I told her it won't last 200 feet. That's the distance from the Borja Family Hospital to the BQ Mall, where I'm going to go buy box tape and gauze. Yes, it will, sir. I says, no, it won't. Now here I am arguing with a fucking nurse in a hospital how to dress a wound, because the idiot didn't know how to dress the wound. This goes to show the incompetence that the Borja Family Hospital portrays to the ignorance of their staff. They don't know how to dress a wound on a foot. So I said to the girl, it won't. Okay, so I'm done arguing with her, right? I didn't take any pain medication, so I wasn't under the influence of any drugs or anything like that. They give me 2 pills for pain. It was like the same pill that you can buy over the counter. You don't need a prescription for the pills they gave me. Okay, so she puts these 2 wraps on my foot, and she takes this tube of Flamicerium cream, okay? She takes the tube, she puts the cream on a little bit, not a lot. She covered the wound, okay, with it looked like it was enough. I don't know what enough is, because by the time I got to the 4th doctor, that asshole wanted me to slather it on 1/4 of an inch to a 1/2 inch thick. I guess he wanted nuclear radiation to be blocked out by the fucking shit. So I look at the tube, and she goes, I said, what is she goes, it will be on the bill, sir. Okay, so she's putting the shit on the bill, which means she's putting the tube that she opened up on the bill. So she puts it on the bill, and for 400 pesos. Fine, I'm going to pay 400 pesos for a tube, and then tomorrow I'll go look for a different brand or another drugstore, or that afternoon I'll go look for another drugstore, because hospitals always charge you pretty much twice whatever the medication costs, 2, 3, 4, 5, 10 times the cost of the actual medication. So she puts it on the bill, and she puts on dressing the wound. Well, okay, first of all, the cost of the surgery itself and the cleaning of the wound was about 2,000 pesos and change, $40. That's cheap. I mean, they only spent half hour with me. It took me longer to explain what they did than what they did. I wasn't in the emergency room 45 minutes. Now, the girl puts the shit on my foot. I tell her it won't work. She says it will work. She puts it on. Then she takes the tube and puts it back in her toolbox. But I wasn't really paying attention to that, because the pain was still pretty intense, and she was just finished dressing it, so it actually hurt quite a bit, even though expat prepper could take the fucking pain. Okay, so I'm not going to forget that fucking expat prepper that you think that maybe you could do that. I'd like to see the fucking video of expat prepper cutting 2 3/8-inch circle of skin off the top of his fucking foot and having somebody hit it with a toothbrush to clean it up with a chemical on it. I like to see that, because I have a fucking video of mine that I can't put on YouTube, but I'd like to see you do it, because you're much more of a fucking man. Your name implies that you're a fucking expat prepper. You're a big fucking guy, big fucking man. I want to see you do what I did. And then I'll say, okay, he's a real man. But until then, just shut the fuck up with your stupid shit that you're more of a man than that. It couldn't hurt that much. It fucking hurt, okay? Anyway, so I get I get the bill. It was like 2,000 pesos for the emergency room. And then that included dressing the wound, and that included whatever costs. Let's just say it was $2,040. Now I got to come back that night, which is cheap, by the way. It's cheap. Now I got to come back that night. I got to go back the next day for the blood work. The blood work was another 2,000 pesos. Okay, and then the next day they're going to dress the wound for me again. They wanted me to come back for 5 days straight so that they could look to see if the wound was dressed. But in the meantime, I said to the doctor, like, this guy was above it all. He was sitting he didn't touch the wound. Okay, he doesn't have to. It's a simple thing for him, but he didn't. And I said to him, you want me to, I'll stay in the hospital. I have my bag, my overnight bag. No, let's see how that works out. So the next day I came back with my bag again. I said, look, this looks pretty serious. Let me stay in the hospital for 4 or 5 days. And you give me the idea. No, you don't have to do that. It looks like it's under control. From the next day, it didn't get worse. There was no more infection. They took the dressing off. They cleaned it. They charged me, I think it was 250 pesos. It wasn't much, $5 to dress the wound. Okay, and I brought the silver sulfadiazine cream with me, and I brought that, and then I asked them the second day for pain medication. Okay. The next day, I came back, and the tests came back. Nothing in the tests indicated any kind of fucking bacteria. Nothing indicated. No bacterium, no gangrene, no nothing. Okay, nothing. Blood cell count was almost normal, considering that there was such an infection, but it wasn't crazy in any direction. And it has about 15 or 20 things. I have that list of shit. Whatever it is, a full panel workup. Nothing came back off the chart. There was no indication that there was any kind of something in my system causing the infection. So the third day, I came back to get the test results, and she charged me $350 to dress the wound. So it went up from $250 to $350. Okay. So I come back the fourth day, and it was $350 again. And then they said, well, from now on, Mr. Fazio, you can dress it yourself. And they told me how to dress it. They showed me what to do using that cream. So I did that. And I came back. He said, come back in a week and we'll debride it again. So I came back in a week or 10 days, whatever it was. And he debrided it again, brings tears to your eyes, because it's still raw open flesh. It didn't heal. That went on for a week. 2 weeks. So I said to the guy, look, this thing isn't healing. Okay, the wound is not getting smaller. There's no your 7 layers of skin are about 1/8 of an inch thick, give or take a few millimeters. Nothing was healing. Yes, sir. I said, well, maybe you should put me in the hospital on there. No, you don't need that. Just keep tell you what, put more cream on. Like add, instead of just putting a cover of cream on, just slather it up. So I said, well, okay. So 2 weeks goes by. Now we're into this for a month and nothing changes. So I said to the guy, I said, look, nothing's fucking happening to my foot, dude. I need to get my foot back in shape. This is these fucking doctors in the Philippines. Somebody that's coming in here late, they suck. Okay, they suck, every one of them. Every one that I've been to. And the dentists are right on par with the doctors. They all suck too. They'll let a small little cavity go without telling you that it's there until you need root canal. That's another story. So a month goes by, I go to another doctor. Same hospital, different doctor. I don't even tell the second doctor that I went to the first doctor, because the first doctor told me to go to the second doctor. He goes, you're going to need to see a specialist. And why the fuck didn't you tell me to see a specialist the first day? He goes, well, I thought we'd get it under control. More bullshit, okay? More bullshit. In other words, let's get this fucking idiot American into the intensive care, into the emergency room 3, 4, 5 times, and we'll charge him the 1,500 pesos or 1,200 pesos for the emergency room. Let's get this mother stupid fucking American in there, and we'll charge him 1,000 pesos each time he comes in, which really it was only 350, but they just wanted me to come into the emergency room for the first 3 or 4 days, and then the next week they debrided it again. I think that was 1,700 pesos. It wasn't quite 2,000 pesos. So meanwhile, I had about 2,000 and 1,700, 3,700, 3,300s. That's 4,600, and the medicines and stuff like that. I had about 5,000 pesos or $100 in the first 2 weeks, 3 weeks. But the bitch who, so I leave the hospital right after they dressed the wound for the first time. And when I leave the hospital, I didn't get 20 feet out the door going towards the BQ Mall, and this fucking garbage, this fake ass fucking bandage shit that they charge $12 a day. It gave way, and it was off my foot. It's the bandage slid off my foot. So let me tell you what I did. So I go back into the hospital and I sit down. I have to think about that. I can't get to the BQ Mall to get the box tape because that's 500 feet. To get from the hospital to BQ is 250 feet. To get into the BQ Mall, it's another 300 feet to where you get the box tape to the hardware store. So it's 550 feet. I need to fix this fucking dressing now. So I go back into the hospital. I sit down. I look around. And in the back, where I took the blood tests the day before, there was like 20 boxes in the hallway. And on top of the boxes, they had box tape. So I go to the back of the hospital, which was like 110 feet from the emergency room. And I sit down and I said, let me look at this fucking bill. So I looked at the bill and I see she charged me for this tube of shit. So I said, that bitch, she charged me for the tube of shit, and she stuck it back in her thing. And when she did it, she was looking at me like sideways, like this, when she put it back in. And I caught that, but I didn't catch what she did with all the confusion and the pain and everything like that. I didn't catch that she actually basically stole the shit. Now, was she going to bring it home? I don't know. Was she going to use it again? Yeah, she was going to charge somebody another 400 pesos for that tube of shit again. That's for sure. So, okay. All right, Scott, thanks for stopping by. Oh, did I miss something about George? Okay. George, if you're still there and you wanted something, George knows how fucking mad I get. Okay. So, okay, so now I'm in the back. I get the box tape, and I tape up the original dressing. I wrap it around the foot, I wrap it over the toes, I wrap it back around the ankle, and I figure eight wrapped it like you'd wrap like a line on a cleat of a tugboat. You make wraps, turns, and then you don't even have to put a knot in it. You just make turns on it. So I put like 6 turns on it, and I get on my feet. I go back to the emergency room. I said, where's that nurse? She took my medicine. No, sir. Yeah, don't tell me no, sir. She took my medicine. I paid for it. It's on the bill. She didn't give it to you, sir? No, why are you asking me if she gave it to me? If I'm telling you she took it. Was I not clear on this? She took the medicine. She charged me she's upstairs. So I have to go up the stairs. And I walked in. Her name was, no, I'm not going to tell you her name. Anyway, I said to her, ma'am, the medicine you charged me 400 pesos for, you put it back in your box. Oh, that's right, sir. Didn't, right away, admitted she took it, gave it right to me. Sorry, sir. Yeah, okay, you're sorry. Whatever, I guess that's standard procedure. Okay. Let's use this cream 4 times or 6 times or 8 times, and we'll charge people not $400, not 400 pesos a tube, because the amount of cream she used, she probably could get five out of it. So let's charge them 2,000 pesos for this tube, because we can get five good squirts out of it. Now I go to the BQ and I used up whatever tape they had from the boxes in the back by the blood work. I go to the BQ and I I buy a regular roll, 90, I don't know, 60 cents, $1. It was like $1.20 for a roll. That shit lasted. I'm using this stuff when I go to the doctor. I'm bringing it with me each day, and they're going, "What do you have this stuff on your foot for?" I said, "Because that shit you give me don't work." "Well, this isn't sterile." I don't give a shit if it's sterile. That's what the medicine is for, and the gauze pad. This is what I'm going to use. You want to put that shit on my foot? You cut off the old stuff, put the new shit on, and then I'll put more shit on top of it when I leave, which I did. And a month goes by, nothing. So I said to the doctor, I said, "Look, doc, this is bullshit. I need my foot to work again." Wait till I get to the fifth doctor. By the fifth doctor, that's the guy who mother effed me and kicked me out of his office. I go to the doctor. I said, "Oh, yeah." He gives me the name of another guy in the hospital. This guy he's the guy you want to go see. Why don't you tell me about him? Well, I thought we could clear this up. In other words, he's fucking with my life. Okay. I go to the other guy, and what does the other guy say? I don't know if they conferred with each other. The other guy says, "Well, let's debride it." Again, with the debriding bullshit. Let's debride it. And he gives me a little bit of a different kind of cream. It didn't say silver sulfadiazine on it. It said something else. It was the only time I bought that one cream. And I went to him, and he debrided it, and that was like 1,300 pesos because it wasn't I didn't have to pay an emergency room fee. It was in his private office. So I went to him, he debrided, he goes, "Come back next week." So I used up that cream, I went back next week, and nothing. Nothing changed. So now we're into this thing let's just say we're into it for 6 weeks now. So it's the end of August. So I said to myself, these guys are fucking me around at this point. They're just fucking me around. They're not helping me at all. They're just fucking me around. So I go to another independent foot specialist, and he gives me the debriding. Let's see what we have here, Mr. Fazio. And he debrides it. I swear, I think these guys are a bunch of sadists. He debrides it, and he gives me the flamacerium, the silver sulfadiazine. Third doctor, silver sulfadiazine. Come back in a week. And now, at this point, why am I coming back in a week? For what reason? So you could debride it again and tell me to come back in a week? But this guy told me this new cream was going to make a difference. Oh, the original guy did give me antibiotics. One panel of antibiotics for 21 pills, 7 days to kill any infection. The second guy did not give me any antibiotics, and the third guy did not give me any antibiotics. So now we're at the third guy, second visit, wants to debride it again. End of August, from the beginning of July. I said, "Nah, you're not going to debride it again." I said, you guys are just a bunch of sadists. So he goes, "I'm the doctor." I said, "You're no doctor. You're not a doctor. You people all got the same opinion. It's all worthless. It's not healing. The foot isn't healing. Do something different. Make me believe you're going to heal my foot." So I walk out. I pay him and I walk out. So that's the third doctor. The first two in the hospital. The third doctor was a separate doctor. Now I go about a month and a half with just putting the silver sulfadiazine on my foot because where I went to the pharmacy, people don't notice, but most pharmacists are almost doctors. Okay, they're very smart. But what they don't know about pharmacists is that the pharmacists know what kind of medication to put on what type of wounds because they're the ones who dish out the medication. So both the pharmacy at Rose Pharmacy and the other pharmacist around the corner, both of those people told me to use the silver sulfadiazine, and they told me how to put it on. Bear in mind now, almost 3 months goes by, and nobody ever tells me you can only use the cream for 10 days. Nobody ever made me aware of that. That was the problem. The cream was preventing the wound from healing, but no doctor told me that. Neither did the pharmacist. So 4 months goes by, and I go to another doctor in another hospital. So now we're into one hospital, two doctors, one doctor, a second hospital, a fourth doctor. And the doctor tells me, he's the guy who tells me in the Romero Hospital. They suck too, by the way. He tells me to use the little cup of Flamicerium cream. Where is that? I'll show it to the people that missed the first part of this. Let's see. Okay, it's not there. It's not there. This is, all right, where's that cup? Anyway, all right, so he tells me to use this cream right here, Flamicerium cream, fourth doctor, second hospital. Tells me, but he's selling it to me in 50-gram packages for $13. Twice, 500 grams, 10. Like it comes out to 500 grams is 10, no, 500 grams in it. So it would be 10 of these. 10 of them would have been $130. So $130 for this. But if I buy it in those little $12, $13 packages, it comes out to $130. If I buy it like this, it comes out to $70. So he tells me, slather it on. We want you to put this shit on a half-inch thick. On a half-inch thick is ridiculous. It only needs to be an eighth of an inch thick to stop the air from. Because what they want me to use are those little packages, the 50 grams that they're selling me. They want me to use a whole package every time I wrap the wound. I'm not going to do that because it's not necessary. Anybody with any common sense would know it's not necessary. So I go and I buy the one cup, and then by this time Daisy May is back from her mother, and the next day she went into the city to do some stuff, and I told her, go look for some of that Flamicerium cream in a big container. She bought that container. That's the container I've had since, I don't know, September. It doesn't use much of it. So I'm using this shit. So the third month, the fourth month, I got this cream on with this fourth doctor. And he tells me to come back in a couple of weeks, which I didn't do. And I came back like a month later, and I put the cream on every day. He's going, are you putting the cream on every day? Because I talked to him on the phone. I'm going, yeah. He's going, how's it feel? I'm going, well, it feels okay, but it's not healing. Come on in. So I go in there, and he charges me like, I don't know, it wasn't much, 700 pesos for the visit. He goes, I'll tell you what we're going to do. How have you been putting the cream on? This is fucking, these guys, how am I putting the cream on? I told him I'm putting the cream on with an applicator, like a spoon, and I'm just putting it on. He said, how are you putting the cream on the dressing? No, I'm just putting the dressing over the cream, like you said. Here's what we're going to do, Mr. Fazio. We're going to take the gauze, and we're going to take a spoonful of the cream and put it in your hand. And then we're going to take the gauze, and we're going to take the gauze, and we're going to mash the gauze around like this and make it like a wad. And I'm thinking to myself, what the fuck is this guy talking about? Well, we're going to make this wad in your hand. We're going to make this wad. We're going to saturate the gauze pad with the Flamicerium cream, so no air can go through the gauze pad. And I'm sitting to myself and going, yeah, okay, we're going to do this once, and then I'm going to find another doctor. So that we do this. Then he takes the gauze pad. You wouldn't believe the show this guy put on. He takes the gauze pad and he's going like this, like getting the air out of the gauze pad. He goes, this is going to make a big difference, Mr. Fazio. And he takes the gauze pad and he packs it into the hole. Packs it up against the edges. He goes, this is going to fix your foot. And I'm going to myself, this guy's full of shit. Okay, so we're going to pay him and we're going to find another doctor, which is what I did. So now I tried, I didn't pack it like that. There's no reason to pack the gauze pad like that. Another month goes by, and the pharmacists are still telling to put the stuff on there. Now, now I go to the fifth doctor in the second hospital, in Romero Hospital, because the first doctor that packed the gauze pad, I went back to his office, and he was in the emergency room. He was not taking calls at his office, even though his office said he would be in there from 10 to 2 on Monday and Wednesday and Friday, and I was there at the same hours. He was filling in for somebody at the emergency room. So I says, "Is there another foot doctor in here?" And the secretary says, "Yeah, there's one." She gives me the name and the room number. No room number, by the way. They're just names on the bill. You believe a hospital doesn't have room numbers on it for the doctors? No room number. The name. So you got to go downstairs and ask, and it's around this turn and down that staircase. No name, no room numbers. Okay, so I find this guy's office, and I got my box tape with the Flamicerium cream slathered on there. I figured, well, I put it on like an eighth of an inch thick, which is more than enough. And then I had the gauze over that. And because I was going to the doctor that day, I took a piece of sterile membrane and I put it on top of the gauze pad so that he wouldn't bitch that the glue from the duct tape was affecting the wound, which it was not. But anyway, so I walk into his office and he looks at my foot. He goes, "Who dresses your foot?" I said, "I do." He goes, "Yeah, that's box tape, right?" I said, "Yeah." He goes, "Why do you put box tape on it?" I said, "Because that garbage that you put on there, the little wrapping stuff, it only lasts a few minutes when you're walking around on it." "Well, you shouldn't be walking around on your foot." I said, "Look, dude, it's 7 months. It's almost 7 months now, 6.5 months. I said, I want my foot to heal. And this ain't work. None of this stuff is working." The guy who stands up, towers over me, he's huge. "Who's the doctor here?" I said, "You're the doctor. But I'm telling you, these people don't know how to dress a wound, and I'm not dressing it their way because it'll fall off before I get outside." "Well, you shouldn't be walking. You should use a pair of crutches." I go, 7 months, I want my foot healed up. Do you want to fix my foot? Do you have a way to get my foot fixed? And I walk out of here with some medicine that's going to heal up this wound because it's not changed since day one. I said, because that other shit healer, and I said the guy's name, he gave me the same advice that the other previous 3 doctors gave me, and none of you people have been able to heal my foot. He went ballistic. He went ballistic that I said I called his friend a shit healer or something to that effect. He went nuts. Daisy was sitting there looking at the guy, and I'm sitting there looking at. I stood up. You think I'm going to let this guy talk to me like that? That ain't going to happen. But let me tell you something, you such and such and such and such. It's almost 7 months, and my foot isn't healed. And you're defending these previous 4 doctors? They all suck. They all suck. Every one of them suck. And you're defending them. It's not healed up. It's 7 months. Anything, friggin' heart surgery heals up in 7 weeks. And you can't heal my foot? Something's wrong here. And he tells me, "Get the F out." How much do I owe you? I take my money out of my pocket. I'm going to put it down on his counter. "Nothing. You don't owe me nothing. Get out of my office and don't ever come back. And don't go to Dr. So-and-so either, because he's not going to treat you either. Well, your foot, blah, 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 your foot could fall off for all I care." So I leave. Now, in the meantime, a guy named Clark had told me he got involved, and he had said that really you shouldn't put that cream on your foot for more than 10 to 15 days, as the instructions on the internet say, but with the addendum that if you put it on your foot for 2 weeks and the doctor says to continue putting it on your foot, it's okay. And all the doctors said to continue. So they weren't breaking any rules, but the medicine itself says 10 to 14 days maximum, unless the doctor prescribes it for a longer period. So none of them were incompetent on that level, except they were incompetent that none of them saw that it was taking 6+ months at this point. So Clark says to me, we're doing the guava leaves. In the meantime, Clark had agreed to, with Daisy's mother and 2 other people, that the guava leaves would help open up the wound and cleanse it, which it did. But then I'd put the medicine on it and it wouldn't heal. So on the 7th month, or be like 6.5 months at the end, when this guy threw me out of Romeo Hospital, Daisy says, Mike, please don't put anything on your foot. Nothing. I go, Daisy, it hurts. So she goes, I know, but the cream isn't working, because she's looking at it from an outside point of view. I'm looking at it. I think the doctors might be right. She's going, it's not working. Everybody, his mother, her aunt, her grandmother, everybody's saying, stop the cream. Just stop it. So I stopped it. Clark said, yeah, it's okay to stop it. He goes, it's not working. So I stopped it. And with that, the tramadol is the painkiller that they first gave me. Tramadol, no codeine, no oxycodone ever, not even one pill. Tramadol, and it's an over-the-counter painkiller. You can buy 100 of them over the counter. They don't care. So I said, well, if I'm going to stop this medication, let's go into the city. I'll buy 150 of these tramadols, because it's going to hurt. Without the medication, while the foot is drying up, it hurt. Not as bad as when they debrided it. So I go to the doctor. I go to the pharmacy. I say, give me 150 of those pills. Why, sir? Because I'm going to New York, which I'm on my way to New York anyway. But I'm going to New York. I'm going to need these pills because I need them for my foot. This is the same pharmacist now, 6.5 months. She knows I have a problem with my foot. I'm not taking these things for fun. Plus, they don't get you high anyway. They just kill pain. So I buy 150 tramadols. They're cheap. They're really cheap. Hello, Princess Anne Newt. They're really cheap, those pills. Ernie, thanks for saying stay healthy. George says, I love how Mike gets mad. He's been watching me get mad for 38 years. So now, that's cold, Warren. Only thing worth saving is the bacteria. That's cold. All right. Okay, George, are you still with me? Okay, you want to moderate a wrench. Are you still with me, George? Make a comment. If you're still with me, I'll tell you what, I don't need to do that. I can do this. Okay. George, if you're still with me, you're a moderator. Expat Prepper, I said, I saw the comment. You could leave that comment up. He called me an asshole. Expat, hey, dumbass. That's okay. I'm going to show the message. Yeah, okay, you can buy it at Lazada. Okay, you can buy, okay, Expat. Okay, Expat Prepper. You put it on your, now that, anything that, calling me a dumbass, that's okay. Telling me I can't take pain, that's bullshit. I could take more pain than most anybody could even possibly imagine. But calling me a dumbass, here, Expat Pepper says, you can buy Epsom salt or magnesium sulfate on Lazada, and you can do that. I agree with you. I don't know that to be the truth, but if you say it, I believe it to be true. But here's what the problem with Lazada is. 4 years ago, I gave Lazada my credit card number. And the next day, I was getting fake charges from China and Ukraine and Yugoslavia. So somebody in Lazada used my credit card information, and it costed me 6 weeks of not having a credit card because I had to cancel that credit card and get a new one. So I don't give my credit card information to Lazada. So I wouldn't look on Lazada for Epsom salts. So he makes a good point. You can get it on Lazada, but Lazada defrauded my credit card, as did my bank. Somebody in my bank, my BPI bank in Cebu, somebody defrauded my credit card. I didn't have a defrauded charge. I was using the same credit card that that was replaced from the defraud 5 years ago, until I went to Cebu in January with Daisy, and I went into my bank and used my credit card in my bank at a teller who had the credit card. Okay, she used my credit card for identification. I had my BPI card, and I threw my credit card and my international driver's license on the counter as ID. I just drew 3 pieces of ID up because she didn't know me. And within 12 hours, I had a charge from some Asian country. I forgot what country it was. So my bank teller at my bank, not my bank teller, but a bank teller at my bank that had my credit card information in her hand but wasn't using my credit card, took the number off my credit card and defrauded my credit card. A teller at the BPI bank. Can I prove it? You could if you went back and had videotape from her looking at my credit card. Maybe she just remembered the numbers. I don't know. But I know I gave her the credit card as identification. So I wasn't using the credit card. I wasn't withdrawing money with the credit card. I was withdrawing money from my account, but I used that as identification. So you want to talk about fraud in the Philippines? It's prevalent everywhere you go. So expat prepper, good point. You could buy it at Lazada. And if you want to give Lazada your credit card and have them bang you out to destroy your whatever money's in your credit card, that's up to you. But I choose not to give. I don't give my credit card to nobody. Okay, I don't stick it down on the counter for identification anymore. I keep it in my pocket. I either use my credit card. I don't even use it to withdraw money. I don't even carry it anymore. I don't need to withdraw money from my bank in America. I just transferred enough money that I don't have to transfer money for several years. So I don't really care about the credit card. It's going away. So, but yeah, you could buy it at Lazada if you want to risk having your credit card defrauded. Now, okay, expat prepper, I believe you. I believe you can buy it. Okay. Good point. Anybody that needs Epsom salt, expat prepper probably has 100, because he calls himself an expat prepper. He probably has 100 plus great remedies for different things because he has knowledge of different things. Maybe he has a channel and you want to subscribe to his channel. I don't see anything wrong with that. Just the discerning how much pain an individual can take, that I had a problem with. But we're over that. Coconut oil is good for your skin, but I wouldn't put it on a wound. Okay, so okay, expat prepper, thanks for the information. Okay, I'm going, George. Yes, George has the power. Okay, George is here. Yeah, baby, and George will wield that power. George, here's the power that you have. COD. I didn't know that they delivered COD. Some things that I did call up for a few years ago to ask for COD, because I understand they have COD. A few times that I called up for COD, they wouldn't COD the products that I wanted. So maybe they would COD that maybe they COD certain things to certain places and they don't COD things to more distant provinces. I don't know. But yes, you can get things from Lazada COD, but nothing I ever asked for COD was approved. What power do you have? You have the power if someone is being belligerent, um, harassing other commenters. Now, I mean, this all in good jest. Like expat Pepper and I had a little disagreement as to whether or not I could take pain. George knows me. George knows that I could take pain. Okay, um, but that was not something that would be worthy of blocking somebody. You can block them for 300 seconds, or you could block them permanently. Okay, but just a little misunderstanding as to whether a man's pain tolerance would not be something I would get upset about unless he came back, anybody came back and said, "Oh, you, I can do, yeah, okay, you could do that someplace else." But so a little arguments like that, you just let go. But so if someone is calling somebody else really derogatory names, they don't need to be here. We all know by the half in jest, whole in heart comments who the ass clowns on YouTube are. So you can block somebody for 300 seconds or permanently block them. And you do that by clicking the three buttons next to their name, I think. I'm not a wrench on anybody's channel. Okay, so I'm going to move on. Maybe another wrench can explain to George what's possible and what's not possible. Because I got to tell you, my wrenches know more about it than I do. Expat prepper. Okay, so pay COD. Good point, but nothing I ever asked from for Lazada. Nothing I've ever asked for would come COD. Okay. Hello, Roberto, the brown American expat. Fazio, I feel your pain. My brother went through the same thing, but he had an infection in his hand and he went through the same issues with his doctors. It took about 9 months for it to finally heal. Well, let me tell you how it did heal. I'll stop reading the comments for a few minutes and I'll tell you how it healed. Okay, so I go and I buy the tramadol, something like that. I buy 150 pills. Mid-January. They give them to me, no problem, over the counter. Not even flinch. Give me 3 boxes, 150, no problem. I stopped taking the Flamicerium cream. I stopped putting the silver sulfadiazine on there. And it started, and I stopped nothing. I'd put nothing on my foot. I did the guava leaves, and then I would let it dry out. And let me tell you, when the guava leaves soaking in super hot water, it hurt. But then when I let it, and then when I let it dry out, I washed it out with distilled water. I bought distilled water to flush out any guava leaf back, remnants. And then when it dried, it started to dry like a sponge, and it hurt. I mean, it hurt a lot. We're not talking about. We're talking about a 2 3/8 inch hole on your foot down to the flesh. It hurt. That what was stopping the pain from having it hurt was the Flamicerium cream, but what was preventing it from healing was the Flamicerium cream. It was killing the pain, and it was killing any ability that the flesh had to regenerate itself. The wound got bigger, smaller, 1/8 of an inch, but never changed size, plus or minus 1/8 of an inch in 6.5 months. When it was drying, it would dry up like a sponge and start cracking. It hurt a lot. Okay, not a little bit, a lot. Okay, yeah, you have an open wound with nothing on it, no medication, and Clark said by a product that I have in there, bacitracin. They don't sell bacitracin in the Philippines. Just don't sell it. Okay. So they put, I had another chemical, like Benadine. I put a little Benadine on it. That was all I put on it was Benadine. Okay. So, and after about a week, I'm talking, it hurt all the time, except when I had the guava leaves and the heat killed some of the pain. It was like the heat hurts, but when I take it hurt a lot. So, but after 2 weeks, you could see the outside edge, which had a ridge, the thickness of the 7 layers of skin and the immediate dermis, the immediate skin tissue under the 7 layers. It was about 1/8 of an inch higher than the opened flesh wound. Okay. And after about 2 weeks, you could start to see it tapering down into the wound. Like this outside skin was starting to encroach into the wound, go towards the center. And after 3 weeks, I had to go to Cebu to take care of some business. And I met some people in Cebu that I had wanted to meet for a very long time. And then from Cebu, Daisy went back to Bahal, and I went to New York. That's the series that I have, Prank the Frank, 1 million peso Prank the Frank series. There's hundreds of them. There's videos of me ordering bagels at midnight and Italian delivery boys coming, and the Italian delivery guy delivers 10 bagels and flagels. I think it was 6 bagels and 4 flagels. And I got a super chat when I said Prank the Frank. I wonder if that was a coincidence. Oh, God. Democracy, doctor. Thank you. I'll say thank you in a minute. And so I got to, I telling people I'm in New York, right? I mean, I'm in Cebu. And so now the wound is encroaching inward. The 3/4 inch hole, you got to remember there's a 2 3/8 hole, a 3/4 inch hole, and a 1/4 inch hole in my foot. And now they're starting to close in. So at this point, I leave for America to make Prank the Frank series. And the reason I call it the 1 million peso Prank the Frank is because I spent 1 million pesos. Okay. But all said and done, by the time I'm done with getting everything to where I want the things to go to and the people I want the things to get delivered to, I spent 1 million pesos. That's why. And all the while I'm in New York, every video I put in, when I was in my condominium in Cebu, I show you a full-on china cabinet with expensive china in it, by the way, that's fully loaded with china. And I show it in the video, but then I show you the cat toy next to the china cabinet, and I go, look, I gotta take care of this guy's cat while he's away. I'm taking care of the condo for 2 months. It's all bullshit. My house. So anyway, the cat toy, behind the cat toy, not all my house, but most, Anyway, the cat toy is in front of a baseboard radiating heating system. Okay, how can I have baseboard radiating heating system in Cebu? How is that possible? But nobody saw the baseboard radiating heating system except a few people. They noticed it. Nobody saw the full-on china cabinet, and nobody saw that while I'm live streaming at 10 o'clock at night, which should have been 10 o'clock in the morning in Cebu, the light is coming from the sun. The sunlight is coming in the window in all its majestic glory, making me glow like a 1,000-watt bulb, and shadows all over the floor behind me and in front of me. There's shadows from the chair and shit like that. And then the light from the skylight is blaring through the skylight, and I went under the skylight and I looked up. I go, they must be doing construction again. They got the lights on outside. Yeah, right. Okay. I mean, I'm lying through my teeth here. I should have had a Vertical Lips t-shirt on at this point. I mean, I should have, but I hadn't. I was waiting for them to be delivered. They never got delivered. I had to go pick them up. But anyway, I got a lot of those bad boys coming, and so that's one thing. Then I go into the bathroom and you see the name of the toilet bowl. They don't sell that brand toilet bowl in Southeast Asia. That's an American standard offshoot. They don't sell those kind of toilet bowls in Asia. That's an American Standard offshoot from 19 years ago. It's a subdivision of American Standard, in case anybody ever looks it up. And they certainly don't have baseboard radiating heating system in the bathrooms in Cebu. And the skylight in Cebu, if it was morning in Cebu, it should have been night. If it was night in Cebu, it should have been morning in America. And the light's coming in, or it's dark. And when it was dark and it was supposed to be light, I'm going, they must have put the drop cloths over the skylight so there's no light coming in. I mean, I'm sitting there faking this whole thing. And the reason I did that, there were three reasons I did that. I wanted to see which one of my subscribers had, my serious subscribers had any kind of observational awareness. Okay. When you run a tugboat, you don't just look ahead. You have your observational awareness is, first of all, where do you want to be? And how do I get there? Because you don't just when you're running a tugboat, when I was running big tugboats and barges and stuff like that, you might want to go to a bridge that's straight ahead of you, but you don't go straight ahead. You have current. So that's called drifting. And if you were flying an airplane, it would be called crabbing. Okay. It's called drift. You're moving sideways. It's drift. Okay. When you want to go back, you crab back into your line of sight or where you want to be. Drift and crab. So you crab along a shoreline where the wind is blowing one way, the shoreline's going straight, and you want to go straight, but the wind's blowing, so you have to turn in like this. So you're crabbing into the shoreline like a crab walks sideways, and you're crabbing into the shoreline, but you're drifting over. So to keep you from drifting, you're crabbing. Okay. So so when you're running a tugboat, you have to observe for drift. Then you have windage that will also cause drift. Wind will cause drift. Current will cause drift. Waves will cause drift. So observation, those are two things that you have to constantly keep compensating, because you do, especially if you're making a toast, because you got a barge behind you, or if you're pushing a barge, you got all the windage of the barge and all the draft that the water is trying to push the barge one way. So you're constantly adjusting for drift and windage. Okay. So nobody noticed any of this shit. You also have deckhands. You got to know where the deckhands are. And the way you know where the deckhands are is either you get your ass out of the pilot house and look where your deckhands are so you don't smack them up against a barge, or when you're making up to something and you don't kill them, because the barges are raked on an angle, like a 45-degree angle, and the rake could come over the side of the tugboat and kill the deckhand. Okay, you got to pay attention to all of this stuff. So observational awareness. There's a freaking baseboard radiator in Cebu. That shit doesn't happen. Not possible. Anyway, nobody caught on. And the few people I did caught on would send me a private message. Mike, they don't have baseboard radiating heating in Cebu. Then when I ordered the bagels, Dennis Adams said, you can't order bagels at midnight in Cebu and have them delivered by a guy with an Italian accent. But when the guy walked up, he walked into my house. He walks into my house at midnight, which was really 12 o'clock in the afternoon, but it would have been midnight in Cebu. And he goes, I got your bagels. I said, okay, bring them up. Brings up the bagels. Says, how much do I owe you for the bagels? And the guy, don't worry about it. So now I ordered 10 bagels and flagels, and now the delivery man with an Italian accent says, don't worry about it. Don't worry about it. Come on. Somebody pick up on some of these clues. So he gives me the bagels, and I come and show them to you. So now I got a guy at midnight in Cebu, an Italian delivery man delivering Jewish bagels at midnight and pickles, and Jewish pickles. And nobody saw this shit. situational awareness. Okay, so let's Daisy, we're going to sing Democracy Doctor. Thank you, honey. Come on over here. We're going to sing now to Democracy Doctor, who's always been my friend throughout all of YouTube history, and we're going to say hello.
Hello, Democracy Doctor 1. Thank you very much. And because of that, we'll sing to you a thank you very much with Michael Fazio. 1, 2, 3.
Thank you, thank you, thank you very much, Democracy Doctor 1. Salamat. Thank you. As soon as I mentioned the 1 million peso prank to Frank, that was threw that money right up on the screen. Thank you. I don't know if that was an accident or a hint, but thank you very much. Okay, so we were at Roberto the Brown American expat, the guy with the boat, the guy with the fishing boats. That's why I saw on Popeye's show, because you have a fishing boat, I call you a fishing expert. I don't call you a fishing expert because you have a fishing boat. Lots of people have fishing boats. I call Roberto the Brown American expat an expert because he catches fish. Fishing and catching are two different things. And Roberto, he catches, so he's an expert. And his brother went through the same thing. 9 months for it to finally heal. Yep. Daisy May channel. You're the best. AMONG, the rest. Among the rest. Salamat, Daisy May channel. Thank you. Blue Rose explains the rules. You can block. Okay, let's go. Let's see what Blue Rose has to say. You can block any asshole you want, George. When you hover over the comment, you'll see 3 dots. You can click those dots, put the user in timeout, or hide the user. Thank you. Okay, thank you for explaining that, Blue Rose. George, Daisy. No, that's not Daisy. I don't know who Daisy is. It's a channel. Daisy May channel. Is that you? Huh? That's you? Oh, okay. That is. Oh, so you started your own channel? That's your old channel? We got to get you set up. We're going to, like I said, we're going to get you set up with, work on that. Remember we talked about that the other day? Work on figuring out how to do that, okay? Well, remind me, make a note, and we'll get you set up with your own channel. Yeah, that is Daisy. I didn't know she had her own channel. She said she's had it for a while. She just told me, yeah, baby, the rabbi is back. Hello, Philo in the Philippines. Now, Philo has real videos about the Philippines. I don't know that. I would imagine Philo would be as upset with the doctor care if he had the same doctor care that I had. But Philo was a little bit less boisterous about it. I guess boisterous would be. Me personally, I think the fuckers should have gave me back my money and the time, 7 months of my life for sitting in a chair with a wound that I didn't need to have. Because after getting back to my foot, after 2 months and 2 weeks or 10 weeks, okay, wait, I stopped putting medicine on it. Okay, I left for New York on March 1st, right, honey?
Yeah.
Okay, March 1st. So February 1st, second week of January, second week of January, second week of February, second week of March, second week of April, second week of May. Well, we're into the first week of May. So 3.5 months, my foot went from that bleeding open wound to 100% healed. But it was healed up after 2 months with no medicine. And after I ate I didn't eat those 150 tramadols. I think the first week I was eating 3 or 4 a day. So I guess that would have been 30. And when I got to New York, I gave tramadols are a prescription medicine in America. I gave about 90 tramadols to a woman that has severe foot pain. She ate them in 2 weeks. I don't know how you can eat that many of them things in 2 weeks. But she said she was eating 4 or 5 at a time, and it was helping with her pain management. 5? Really? 5? I would have 2, and it would knock me right out. So anyway, yeah, my foot healed up by itself with no pain medication, no doctors, no bandages, nothing. I just wore an open sandal. I did not. I let it rain on my foot. I let water splash on it when I was walking through the streets in New York City in the subway system. I just left it a bare open wound. I never washed it except for when I took a shower, and it healed up by itself. Okay, so on Popeye's channel, Popeye was talking about the bacteria in the streets of the Philippines. True. What caused my injury, no one ever figured out, although I spent about, near as I could figure, I spent 5, 10,000 on medicine. That's 20. Didn't we figure I spent about 10,000 on medicine? Was that correct?
Yeah,
More? What was the final figure? 15,000. So I guess I spent about 15,000 on doctors and emergency room services, and 15,000 on medicine. Probably cost me close to $3,600. And all I really needed was that first visit and to stop putting shit on it, and it would have healed. Okay, so yeah, expat prepper doesn't mean any injustice here, but we will we'll just move on so that yeah, he's not. There's no belligerence here between me and expat prepper. Just leave him alone. He has helped after we had our original disagreement. Philo is Daisy Mae's second sub. See, I don't really pay attention. Daisy told me she had a channel just now. You guys knew about it before I did. I don't keep tabs on Daisy Mae. Well, when we go into the city, I don't let her out of my sight. There's so much traffic in the city. God forbid one of us gets hit by a car. I like to go into the city with Daisy, and I like to stay within eye distance when we're walking around in case some guy on a motorcycle or a jeepney strays or gets a flat tire and hits us by accident. The other person can take care of registering us at the hospital or the doctor. You could be unconscious. So that when I say I don't let her out of my sight, I mean because if she's walking down the block in the city and she gets hit by a motorcycle and she's unconscious, who do they contact? Her pocketbook might get thrown in a different direction. Her cell phone might get broke. We keep each other in eye distance. Okay, so thank you, democracies. Like big balls of Fazio. Yeah, the trip that I made to New York, democracy doctor, man, I was told by not a few people, a lot of people that watched what I did while I was in New York, emptying several tons of equipment from a second floor warehouse down through an old, like a collapsible staircase, either on ropes or with electric winches. I was told that even it wouldn't make a difference what age anybody would be to do what I did and organize the stuff to go in 5 or 6 different directions. I had 17 tons or 18 tons of stuff I moved personally, but I might have moved it 10 to 12 times, some of that stuff, to organize it to go in different directions. I was told that it wouldn't matter how old or young anybody was or how strong they were, the logistics of it all and the fact that one person did it made it a monumental or Herculean effort. And I succeeded. I succeeded in what I wanted to do. I had stuff that, not much that was thrown out, but I had stuff that didn't need to be going to the Philippines that I sent to other directions. Like, for instance, I left some stuff for my friends that didn't need to go into the container. I don't need a pair of Serwin Vega 15 speakers that are 22 inches wide and 3 feet high and 22 inches deep. I don't have a place for them. Okay. And I don't need them. I don't have a pair of speakers. And what am I, where am I? I can't, I can't leave them outside. So that was the kind of stuff I wrapped them up to send them to different people. George. And that railing is yours also. And that railing is well over $1,000, George. That piece of railing. So try not to scrap it. Put it in the back where your mom can enjoy it. That's a beautiful piece of railing. I think those sections were $1,200 a piece back in the mid 2000s, and I used one section in the gate. The gate itself was $1,100 to match that railing, and the gate was only 42 inches wide. That's a nice railing. What you've seen, I'm hopefully by now you have it. But anyway, go get it. So yeah, I was told by quite a few people that to do what I did, no one would take on the effort, and the people that watched me do it on a daily basis, that didn't help, and because they have certain injuries that won't allow them to pick up more than a few pounds. They would sometimes stand there and watch what I was doing, moving boxes that weighed 35 to 50 pounds, moving them 6 or 7 times to organize all the pipe fittings, all the copper. I'm bringing copper, I'm bringing PVC, I'm bringing PVC fittings, I'm bringing industrial drill presses. I brought 2 industrial drill presses because I had 4. I ended up selling one and giving one away. A 5-foot drill press went to one lonely farmer, 5'6" drill press, $1,300 drill press. I worked out a deal with one lonely farmer. He took a lot of stuff from me, one lonely farmer. So I worked out a deal, and him and I spent 2 days together. We'll have those videos coming up. It was a monumental effort. Scott Del Fuego, also subscribe to your channel. Yeah, I'll get a live stream up for Daisy Mae's channel. She's going to be posting all my old on-time backhoe. When I went to New York, I have 5 3-terabyte drives with about 2,000 plus videos, as some of them as long as 2 hours long. They were made with a camera that would record for 2 hours, and the videos were downloaded into the drives at 2-hour videos. She's going to be recording the old Michael Fazio barge videos and my ocean racer videos and Key Largo videos where we went ocean racing and we went to the different events with the ocean racers. I have not a lot of that stuff, a couple. It's actually hard to run an ocean racer and do video, but I have a couple of videos where we went to in outside of Miami, between Miami and Key Largo, and it sounds like a lot of boats, and it sounds like a horseshit story, but 15,000 boats gang up on a holiday weekend, the Memorial Day weekend, 15,000 boats gang up. People start coming on a Tuesday or Wednesday morning, and they get into the center of the mix. Okay. Now, if you're in there on a Tuesday or Wednesday and you have like a dinghy, you can probably get out if you wanted to. But if you're in there with a 35 or 30 foot, but mine was a 33-foot boat. If you get in there on a Tuesday morning, you need to have food and drink for 5 days, because it don't break up till Sunday, and you cannot get out of the middle of this fest. Every boat is gang tied to the next boat over. It's a little scary because you got people walking across your boat, and you can't really have a lot of valuable stuff on it because you got people going through your boat when you're in the water. They'll walk onto your boat. You won't be able to see over the rails, and they're looking for your wallet and your ID and stuff like that, any jewelry that you got. A little scary, but I got video of that. So Daisy's going to be posting a lot of Michael Fazio's original videos with Barge Dragon, stuff that was taken down from my first channel. She's going to be posting a lot of stuff with her dancing, where she just went to a 3-hour Zumba. She participated in a 3-hour Zumba. Daisy's channel is going to be eclectic. There's not going to be any Dick of Doom videos on her channel. There's not going to be any Rabbi Jew Barker videos on her channel. It's going to be my old original stuff with running cranes, barges, tugboats, and her dancing, Zumba. So she's going to have her own channel, and she's going to have get a subscriber base going and start her own thing. Democracy Doctor said you're welcome. Thank you again.
Have water there?
I need some water, please. Faz's Comedy Gold. Thank you. Yes, Democracy Doctor. Warren is a 19-year veteran of the Australian Police Department. Daisy, would you please put the medicine stuff away? I don't need any of that stuff anymore. There's 2 tubes here and here. Let's get rid of it. Take this and this and this. Okay. That's it for that. Louis Hernandez, good morning. Thank you for stopping by. I don't know who you are, but you're a new name to my mind, but thanks for stopping by. Daisy, whenever she's not doing something, she's doing something. Sewing, honey, where's the blue pouch that you sewed up yesterday? I was going to put duct tape on it, the blue pouch. I was going to put duct tape on this pouch, which would have worked, but duct tape wouldn't be the end-all, be-all, but I was just going to buy another pouch. So I said to Daisy, would you put some papers? Oh, okay. I have some documents here. I'm setting up a different contract for the property I'm on. I wanted to make some changes. I had some professional help with that. So I said to Daisy that the edge of the pouch is separated, but I want to put some papers in it. I just said, let's put these papers in the blue pouch so that we could bring them to the city and get them copied. I have one copy for the lawyer, one copy for the lessor, and one copy for me, so we can all read from the same page. And instead, Daisy took a sewing needle and she put a little stitching across the entire length of the pouch where it looked like it was separated or going to separate. On all the sides at the bottom, a little small repair right there. she took the onus on herself to repair the whole pouch where the edge was looked like it was wearing, because the pouch is quite old actually. This is from Excel title of the keys, and it's from 1999, from when I bought my first house in the Florida Keys. Uh, so so basically it's 20 years old, and she repaired it. So she always keeps busy. Democracy Doctor, as I just said, she sews. Yeah. Not only does she sew, she repairs. Daisy, show me the. Do we have a pair of shoes that you repaired sewing? Please, I want to show it to Democracy Doctor. Any one of the shoes that you sewed? Any one of them, new, old, whatever. If the heel is coming off the shoe or the sole is coming off the shoe, she we have an awl, and she pushes the awl through it. But more than that, I gave her a little drill bit to put in a drill, and she puts the drill on the table, and she drills through the whole shoe, right through the shoe in every place, and then she stitches up and down through the shoe. Okay, these are my shoes that she sewed. That Democracy Doctor, you got to understand. This is a 2,000 peso shoe, $40 shoe, and they fall apart relatively fast. And what Daisy does is she stitches everything back together. So instead of paying 2,000 pesos for a new shoe, that's one side like that. She'll stitch it back together internally. And here's the other side. So she'll sew the material back down to the rubber sole. And she'll do this on her own. I never asked her to do this. What I did do one day is I did it with her in the shop. And she helped me by putting the thread on the airplane, the big stitching needles that the thread came on, that we put it on the thread. She helped me with that. And then after that, she would say to me, Michael, I'm going to use the drill, and I want to sew some shoes. And she would do her own shoes or my shoes as needed. Now these shoes, she used a different kind of thread. That was a nylon. This is a high tensile strength nylon. And she used the white nylon to match the white shoe. And she sewed these around here too. Now these were shoes, I think I paid about 400 pesos for these shoes, but they didn't last very long. It's not a good quality. But Daisy repaired them 2 years ago. Now the repair is 2 years old. The shoes didn't last 2 months when we bought them, and now the repair lasted 2 years plus. So, yeah, to answer your question, yes, she sews. And I think that's really cool. Also, Democracy Doctor. Democracy Doctor, I think that is really cool. Yeah, she's an excellent cook. Oh, God, an excellent cook, amazing cook. Thank you for the compliment. Democracy Doctor thinks that's wonderful that you can do all that stuff, Daisy. The camera, George. The camera's over there. The camera's over there. The screen is over there. I'm not working off of a. I'm not working off a laptop webcam. I'm working off of a. I'm working off of a wired, a webcam with a wire on it. Now I could go like this. I could look into the camera if I put the webcam in front of me, or I could just look at the webcam. But if I look at the webcam, I can't see the comments. That's why, George. Good question. Okay, Daisy, Warren asked, what were you sewing outside? What?
The bag.
Can't hear you.
Bag.
Let me see. Show them what you were sewing. Daisy's going to show you what she was sewing outside, Warren.
I saw the bag for the one that we put some groceries here. This is the bag that I win for the prize of my Zumba. This one because it ripped up in here. It got open, and then I saw it here all. This one from here, so that it will make very strong from here. And then the handle, I sewed it for 4 times so that the thread is make very strong. The handle is not so strong, so I sewed it up. It's from here to bottom. I sew also because they only put 1 thread, so it's not very strong. That's all. Looks like you're doing a good job as always. Thank you, Warren. That's so. And Democracy Doctor. And this is for the bag for personal collection that my prize for Zumba.
Show them the prize and what you got the prize for here. Let me have the bag. Tell them about the prize and how you won it.
And this is my prize. It's very.
All right, so tell them how many people were in the Zumba contest, about.
What?
How many people were all together in the contest?
The people, the contestant is almost 200. And then I'll win for most energetic dancer. So I got only for top 10, and then the next round is top 4, so I get loose because they fuck.
The judges and all the winners were all from Tagbilaran, but Daisy did get the prize for being the most energetic dancer, not the best dancer, but the most energetic, which I thought was amazing, considering 200 people. And how many people got the most energetic?
Only me.
Only Daisy. Out of 200 people, only Daisy got the most energetic. So she was the strongest, most energetic person out of 200 people that do Zumba every day. And she did Zumba for 3 hours without stopping even for 10 seconds, right?
Yeah, that's right. Non-stop dancing.
For 3 hours.
I'm the one who did not stop, but all the rest always drinking water and then stop for about 2 minutes. And for me, I did not stop. I only stand in one position. So where I'm doing Zumba, I only standing and then make some Zumba again. No stop, not allowed.
That's right. And she practiced by Zumba dancing for 3 hours. Welcome back, Scott. She practiced by Zumba dancing without stopping for 3 hours. That's how she practiced. She didn't practice for an hour or 2 hours and then go try and do a 3-hour contest. She actually did 3-hour contests here at the house while I was in New York, yeah?
Yeah, I did some practice here inside the house with my mother, and then she told me that I need to put something in my mouth.
All right. What was it that you put in your mouth to keep you from having cotton mouth? What was it? Ginger?
I put ginger in my mouth just a taste. You feel don't feel weak, and a candy in my mouth.
Very good.
Sweet.
Okay, I'm gonna get back over there, honey.
Thank you, everyone.
All right, so you can see that Daisy is not a slacker, that's for sure. So I'm going to just run back up these comments. Yeah, stuff doesn't last anymore, Warren. You're right. Size 13. Oh my God, 13. I, because of the way they're cutting the sneakers now, I actually need an 11 and a half or a 12, where 10 used to work. I'm gonna do a live stream about the REI sporting goods industry, which has taken a turn for the worse. But that'll be a different day. $10 for a plastic. Yeah, we use our own bags also, because we don't want to use up the plastic bags. They are gluttons here in the Philippines with plastic bags. They put plastic bags on everything. Instead of giving you one plastic bag for 2 loaves of bread and 10 rolls, they'll give you the 10 rolls in one plastic bag, and then they'll give you a plastic bag for each loaf of bread. So they'll give you 3 plastic bags where they could put all of that crap. I mean, the outside of a bread bag is sterile. It's not like it's poisonous. They could put it all in one bag, but now they'll give you 3 bags. And just a waste. You get home, you throw out 3 bags. Whereas, so we bring our own bags pretty much everywhere. And if they do put rolls in a bag, I ask for paper. Warren said, "Congratulations, Daisy."
Thank you, Warren.
She said, "Thank you." I can't. I did Zumba the other night. I have a video of it too. I did George. I did Zumba the other night for about 3 minutes. George, am I looking in the camera now, buddy? And I did Zumba the other night, and I'm not. Well, from this foot injury that I had, I gained 35 pounds. It's just that simple. Sit in a chair for 7 months. And even though I reduced the amount of food I took in, it all turned to blubber. But now, actually in New York, I lost 2 inches off my waist, but I gained 14 pounds. I need to go, George, I need to go on a diet. I agree. I need to go on a diet. All right, let me go through these comments. Laura Seagrass, friendhood, may I excuse, need to go prepare things. Thanks and hello. All right, but Laura, thank you for stopping by. Yeah, Blue Rose. Daisy is full of energy, all right. She never, the funny thing about Daisy, she's always doing something. Always. She's always busy. She never just like lays around. Very rarely will she ever just lay down and just relax. But she does like to take a half-hour nap. And I let her every day. I make her take a nap because that's what her body wants. Her body wants a nap at some point in the afternoon. Sometimes I'll take a nap with her or just relax. I don't require a nap, but I can get through the day without a nap. But I do enjoy a nap if I get a chance to do one. But Daisy likes to lay down at some point. between 1 o'clock and 3 o'clock and take a nap. And for the rest of the time she's awake, she's doing something, cooking, cleaning. This what it. She started two businesses when I left for New York, which I'm very proud of her for. Money wise, sodas, and the live stream just went out. I like my camera where it is, George. But if you want, I'll tell you what, George. I'll tell you what I'm going to do. I'm going to take this little clip-on thing here, and I'm going to clip it onto my computer. How's that, my friend George? Hold on. I'll just raise up this. Hold on. This is for George. George, which way did I go, George? Which way did I go? How's that? Is that better? It does have a clip on it. You can put it on your collar of your shirt. Okay, George. All right. Okay, so I'll slide it over this way even more so that now when I'm looking at the comments, I'm actually looking at the camera. Yeah, George has me rearranging. It's not a bad thing that he has it. Yeah, that's better. Oh, yeah. Now I can see the comments and the camera can see me. Thanks, George. There you go. All right, so yeah, she put ginger in her, like a piece of ginger, Daisy, like a chunk of ginger under your lip, and that made her go without having to drink water. And a piece of candy under the lip also. And that was your grandmother told you to do that?
No, only the ginger, but I'd like to have a candy because I don't like the taste some of the ginger.
Okay, so her grandmother, it's like an old Indian trick. Her grandmother showed her how to put the ginger under her tooth, under her lip, but she put the candy, lemon candy, under her lip to kill the taste of the ginger. But the ginger, apparently, like one of those old Indian tricks where they put a rock in your mouth so you don't get cotton mouth. Okay, so Scott says Daisy's great. Her editing skills are getting much better. Yeah, they definitely are. I'm missing something here. 10 cents Foz. What was 10 cents, Democracy Doctor? Those plastic bags? Okay, so now I'm looking in the camp, almost. George is happy. So it doesn't take much. George is quite good at everything that he's ever done in his life. When he was into the gaming back in the 1990s, or maybe the early 90s to mid 90s, he was one of those people that found every back door and every place that they hided stuff that had hidden things to go through doors and stuff like that. He wouldn't stop until he figured the game out. He was really good. He's very good at what he does now also. I won't tell you what he does now, but he's very good at it. And he loves his job. He also had a lawn maintenance company, and he repaired all his own equipment and his own trucks and stuff like that. And the job I saw him doing, it would take a full-fledged automobile mechanic to do what George was doing. It was an amazing, the way they screwed the cars up in America is just amazing. The way they screwed up the cars in America. George had a Cadillac. I don't know what year it was. They have lights in the Cadillac, in the front wrap. The wrap, the bonnet that goes around the front of the Cadillac. Okay, let's just say the light is about a foot square. And inside that 1 foot parabolic type reflector is a bulb. It's not much bigger than the tip of a pen. It's not really that big at all. Like this little blue part of the tip of the pen here, it's not much bigger than that. And that's 1,000 watts. In order to make that light work, there's another piece of metal, electronics. It's about the size of this cell phone camera, but twice as thick. This electronic mechanism is the part that generates the power for the light. And I guess it operates the flashes and stuff too. And these idiots that built Cadillac took this metal box with the electronics in the box, and they put it at the bottom of the light assembly. So any moisture that builds up in the light assembly, moisture that drips down into the box and rusts the box. And I forgot what the lights cost. George told me, but I forgot. Several $100s. I think each light was $1,000 if you have to buy the light separately. So, but in order to get in order to change that bulb, you have to take I don't know if it was 100 plus pieces off the front of the car. You know, you need a special tool, the fork tool to pry stuff up. You need a special tool to reach in to get other stuff to free up pieces. But you need to have a special set of tools, like for taking the panels off of car doors and stuff like that. But you need to have those tools for that job, like whatever they call it, front end assembly tools. George has all of that stuff. And in order to change this light bulb, the light had cracked, so George had this plastic putty that you put a chemical on, and it gets hard. So you use it as a putty, and then you spray a chemical on it, and it makes it hard, like hard plastic or heat. He had a couple of different kinds. So he's a full-fledged mechanic, George, just to give you an idea. So, and in order to change those light bulbs, it was several $100s for Cadillac to change the light bulb. So George had the whole front of the car. I have it on video, but I won't put it on YouTube. But George had the whole front of the car. I'm only going to send it to George so he can show his friends what he can do. But George had the whole front of the car assembly off, and he was making molded plastics and sealing up the metal casing, because those things were several $100s. George is a full-fledged mechanic for anybody out there. So everything that George does, he does. George got, yeah, right. I do have video of it. You're right. I just wouldn't show everybody the video. The video is I have more chins than a Chinese phone book, Warren said. Okay. So, yeah, no, I have video of it. I'll send you the video. Because, George, I'm looking away at the camera, because for a year the camera was over there. Now the camera's over here for a year. So it's 1 year that I'm looking at. Okay. Okay, the plastic bags are 10 cents each. That's quite expensive. That's a quarter of an hour's wages for a Filipino. Oh no, 10 cents is 5 pesos, and they make about 50 pesos. That's a tenth. So if they use 3 plastic bags to put your groceries in, that would be 15 cents. 30 cents be 15 pesos. That would be a third of an hour's wages for 3 bags. Yeah, it gets expensive. Yeah, I don't, George, you can tell people what you are, that you do for a living. That's your prerogative. I don't tell other people what people do for a living. If they choose to put it up there, right, that's fine. And you should be proud of it. You do quite dangerous job for sure, working with that big heavy equipment. And he replaces the poles. He's the person that when they switch the wires from one pole to the other, George comes in and pulls out the discarded pole. He's got a winch, and he's got a drill rig on his crane, and he operates heavy equipment. Yeah, George is quite the mechanic. Okay, George says, I'm talking about the head bulb and igniter. Okay, so I don't know what the names of that stuff is, because I haven't had a car in many years. So, and I never saw what the kind of bulb system that George was repairing. Okay, so right, I got the headlight assembly. One headlight assembly is 1,000, not 2. Princess Anne Nude. I'm not real sure who this Laura Seegest is. But you tell her what's on your mind. Don't worry about it. She is gone. You're right about that, Princess. That person, what I'm just discussing, I would never tell anybody what George's personal job is. If George chooses to share that, it's his business. But you're right about the personal questions. Okay, so you have a different plastic bag. You know what, Democracy Doctor? We have a bag similar to that here in the Philippines. They charge 10 pesos for a reusable bag, and it'll hold 15 kilos. So 10 pesos is about 20 cents. So yeah, they are a good deal, because I've had one for a year and a half. I don't use it every day, but I've had one for a year and a half. And so for 10 pesos, it's definitely worth it. Yeah, the personal questions thing, soon as I don't know who it was yesterday was on, or the other day was on my live stream. They start off with, hey, how you doing, blah, 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 and then they start asking personal, me, I don't care about the personal questions things so much, because I have so many videos with things I've done. But there are certain things that I just wouldn't put up on YouTube. So that's, I agree with you. Now I should talk about the dentists in the Philippines, because they suck as much as the doctors. So let me get this. Here I am talking into the camera. I'm talking in George. Which way did I go, George? Which way did I go? The dentists. I had a filling right here. Okay, a little cavity right there. I'm in Cebu. I'm here a week in Cebu. No, I'm here a month in Cebu. And the cavity, you could, when you were cleaning your teeth with a toothpick, when you're picking your teeth, you could feel it's a cavity. It didn't go into the nerve or anything like that. So I go to the top of the stairs at the Alamo Mall, and it's something called Love Dentistry, or the dental love, or some bullshit, right at the top of the escalator in one part of the Ayala Mall. And I go there and I tell the guy I got a cavity, and he looks at it and he agrees there's a cavity and he's going to fill it. So this might have been, I got there in January, it was February. It was before March 15th it might be maybe March 10th, because I moved to Bohol on March 15th. I had spent a few weeks in Bohol before that, but I moved to Bohol March 15th. I go in there and the doctor charges me 1,200 pesos. No cleaning, just to repair the tooth. And I said to him, drill out when you make the hole, don't just make a hole straight. Make the hole wider on the inside than the outside, so that the material you put in there is tapered like a lag bolt. Yes, I know how to do that, he told me. Well, that prick makes the cavity, fixes the cavity. I moved to Bohol on March 16th. Within 1 day of getting to Bohol, and I had an apartment all set up that I had rented in February, the filling falls out. Well, I'm in Bohol now. I'm not in Cebu, and I'm not going back to Cebu. So I go to another dentist at Romero Hospital. And I got to tell you, going into Romero Hospital for the first time, this was the first time I was in a hospital in the Philippines. It was not scary. I wasn't frightened. I'm in a public building. It was a freaking eye-opener. How many different types of really serious injuries and tumors that, on their face. And and in order to get to the dentist, it was in the sub-basement, and the hallways had these wooden benches along the hallways, and it was strange for me. I've never been in a hospital with just there's no natural lighting from anywhere, just bulbs and hundreds of very, very sick people, mixed in with people that were not so sick. And the dentist is all the way down at the end of the hallway, and it's the last door, and then it's down 3 steps into her office. So I'm in there and I'm going, this looks like a horror show. And the little boy that was in the dental chair before me was screaming like it was a horror show. So anyway, the woman, it's a woman dentist, and I showed her the filling. I said to her, this filling was only in my mouth like 3 or 4 days, and it fell out. Can you fix that? Yes, sir. So I asked her how much. She told me 1,500 pesos. I said, the other guy charged me 1,200 pesos and it didn't work. If I pay you 1,500 pesos, is it going to work? I mean, this isn't fucking rocket science or anything like this. This is here's the hole right here. Here's the tooth. I don't know if you can see it. Here's the hole. It's a straight in. Fill it up. It's not in the back. You don't need mirrors. You don't need grips to hold my cheeks back. It's just straight in. Can you? Yes, sir, we can fix it. So she does her grinding thing, and she uses the whatever, and she fixes it. And I leave, and I paid her 1,500 pesos, which was like, at the time, the peso was like 38 pesos to the dollar. So it was like $50 for the filling. Okay, now I already just spent $30 on it in the other one, 1,200 pesos. Anyway, it lasted, I don't know, 5 days. So I went back there, and I went back to the hospital administrator on the floor outside, and I said to the hospital administrator, this freaking woman. Oh, and I have another thing about earwax. Okay, the same day that I went back the second time to get my tooth filled, I went to get my ears cleaned because I had wax in my ears, very deep embedded wax, the hard wax, which stops me from hearing. And I wanted to get them cleaned. So I go there and I tell the hospital administrator, this freaking lady, she did this job 5 days ago. And when I went to her office, she wants to charge me again to fix my tooth. I want her to do it for free. Oh, so I'll come down to the office with you. So the administrator came down to the office with me and talked to her, and they agreed that she's only going to charge me 1,000 pesos. Why are you charging me anything at all? Your fucking work sucked, and you're charging me 1,000 pesos. Why are you charging me anything? So I agreed to get it fixed for 1,000 pesos rather than to find another dentist. I sat down in the chair, and she was talking some blah, blah, blah. And then she went outside the room, and she was talking some blah, blah, blah with somebody else. And I'm sitting in the chair like 10, 15 minutes. And I said, you know what? I'm not going to have this woman fix my tooth. She charged me 1,500 pesos. She wants another 1,000. I don't care that she's going to do it right this time. She ain't doing nothing this time. So I got up and I went upstairs to get the earwax removed. There was an ear doctor. These doctors in the Philippines and dentists, they just suck, just straight up and down. They suck. I go into it says ear doctor, and inside the room, packed solid. You have to go to the administration. You have to go to the information desk to get a number to go to the ear doctor, or to go to any dentist. You got to get a number. All right, George. All right, George. Thanks for stopping by. Okay, so now I go back up to the administration desk and I get a ticket to go to the ear doctor. And the ear doctor wants 1,500 pesos to clean my ears. I guess they just have this standard 1,500 pesos. So I fill out the form and I go in there, and my ears are clogged. I know they're clogged. I can feel the earwax with a toothpick. You can feel it. It's like hard, like plastic. I go into the office. I said to the nurse, can the doctor clean my ear? Does he have the little power washer and the suction to clean my? Yes, sir. Okay. I go sit down. I wait about not long, an hour, but whatever it wasn't long. I don't remember it being extremely long, because there was 2 doctors working out of the same office, and most of the people in the office were guests. They were, friends of people. So I go into the office, and the doctor, he sits me down. He sits me down in the desk, in the chair, and he goes like this with the lighted magnifying glass. He goes, sir, you don't have any wax in your ear. I'm going, yeah, I do. I can feel it with a toothpick. No, sir, that's normal. I said, I can't hear anything, and my hearing's getting worse to the point where I can't hear the television if it's on super loud. Sir, you don't have any wax in your ear. I said, well, I'm telling you I do. So now I'm not going to let this guy fix my ear anyway. Now it's just a question of him. So I get up to leave, and he goes, sir, you have to give me 500 pesos. So I'm not giving you nothing. What do you mean? I'm not giving you anything. You didn't do anything. Your secretary said that you will clean the earwax out of my ears for 1,500 pesos. And you're telling me I don't have earwax in my ear, and I can feel it with a toothpick. You could, if you really wanted to work it with a toothpick, or if you had like a dental pick, you could pull a piece of wax out of your ears. It was like a piece of plastic, but you couldn't get into the eardrum, which it was covering up, and I actually couldn't even hear the doctor talk to me. That's how bad it was. Well, I ended up not paying him. We came to an agreement that I'm just not going. You didn't do the job. Why? We had to get the administrator, of course, to get that. We made. I said, you know what? Just go get the administrator, because it says on your thing, ear doctor, earwax. And I told the administrator, look in my ear with the tool and look to see if there's earwax in there. And they did. And they both came to the conclusion that there was no earwax, but the administrator came to the conclusion that I didn't have to pay because he didn't do anything, which means there was earwax. That would probably, what it meant is that he didn't have the water pick or tools to get the wax out. I don't know what it meant. All I know is that the doctors in the Philippines and the dentists, they all suck. So going back to now I still need my tooth fixed. So I go to another dentist, and he actually fixed my tooth and found 2 more cavities that he fixed. And he found, and I knew I had the cavities, a root canal, needed to be root canal. And he did it. Now we're talking March, April of 2014. So we are talking 5 years ago. That's the same dentist did a root canal, and no problem since then. Not one problem with any of the root canals. What I do have a problem with is that the guy will see a cavity, and he won't tell you that there's a cavity until it gets real big, because he doesn't have an X-ray machine. He takes little things. So these doctors here in the Philippines, they would rather have your little thing turn into a big thing so they could fix a big thing, for like a tooth. So I just recently had 2 root canals done on teeth that were worked on many times over the course of my lifetime. So, and they're not expensive here. 36,000 pesos for 2 root canals, which is $600. And that includes the root canal, the preparation for the crown, and the crown itself for 2 teeth. The crown is 9,000 pesos for each, and the root canal was 9,000 pesos each. And then if you have x-rays, it's like 700 pesos per x-ray. So it came out to 36,000 pesos total. Does good work, but he'll let a small cavity become a big cavity, and they won't say a damn thing about it. And I had my teeth cleaned by another dentist twice, because he was too busy to clean my teeth, and that other dentist let the small cavity become a big cavity. He said, "You don't have any cavities, sir." So when I went back to the better dentist that did the root canal, he said, "You have 2 big cavities." I'm going, "Why didn't the other dentist tell?" Because I thought it was his wife, because they all have the same freaking name. Apparently, I guess it's his long-lost cousin or some bullshit. Oh, no, that's not a relationship to me. I thought I was going to his wife when he was too busy to do my work. They all suck. The doctors, dentists, I have nothing good to say about any doctor or dentist except he did good root canal. But I don't think I would have needed the root canal if he would have fixed my teeth when he first saw the problem that I had to begin with. Yeah, Scott, yeah, George also does dock building. He does his own dock building. I built George's all around his house. I did concrete. I prepared for the men to do the concrete. I built all the forms. I did, actually, I just talked to his mom. I was there a couple of weeks ago. Mom said I charged her $20,000 for a job back in 1990. I must have made a lot of money on that job. And the concrete stayed. And it was concrete. It was a concrete patio, like 15 by 18 or 15 by 20. 75 feet of a sidewalk on the side of the house with steps up to the concrete patio on both sides, and then another section of concrete walkway in the back of his house. And it actually all lasted except for one small section. The concrete deck, we filled in the concrete deck, and I put the material in lifts, and I did everything right. But what happened is it was built over, it's on the water. It lives on the water. And what happened is the water from all the storms eroded underneath the concrete deck, and a small portion of the concrete cracked and fell into itself, like a 6 foot by 8 foot section. And George broke it out. But the concrete I put on there was a full 6 inches thick with rebar and stuff in there. His mom wanted it flat, and could have lived with it forever. democracy doctor is correct. If not for guys like us with big balls, society would stop within days, and it would. He's absolutely right. If there weren't men to pick up where the slackers leave off, nothing would get done. Amazing. You know, going back to democracy's comment and Scott's comment, where Michael's friends are all men. I have friends that are not. That's a different part of my life, but my close friends that I can associate with, they all have to be men. If we're going to go do something, I can't be holding anybody's hand while we're doing it. And like if I'm working, and somebody comes by, well, he has the tools that I need, and he'll pick me up with a truck, and I'll go to his place, and I'll bring my own lunch. And if there are guys, thank you, Richard Lee Rogers. If there are guys at the yard that stand there and start, I don't know if I'm my lying white man, holes in the bottom of the radiator. And the theory was just keep 10 gallons of water on the machine in the morning, and it should use less than that all day. Do you really think I'm going to get out of a machine, or somebody wants to get out of a machine several times a day to check the water in a radiator to add a couple of gallons at a time? No, that's just not any way to do. So I told the guy, look, I need to take the radiator out of the machine, and I'm going to charge you for this. This is going to cost you money. Not only is it heavy, it's radiator weighed 90 pounds, but not only is it heavy, but I need to rebuild the brackets underneath, and I need to get a rubber harder than what I used was irrigation hose. Irrigation hose is about 3/32 of an inch thick, but I used 8 layers of it. So it's a cushion, and that will allow the radiator to ride on a cushion. And where I built the framework underneath that wasn't exact, it'll crush a little bit more in one place, a little less in another. And the irrigation hose will also prevent it from holding water under the radiator, where the previously in there, and then it's amazing. So, but those guys are standing there watching me work, and they don't help me. Like if they see I need a hand, and they don't offer to help me while I'm working on, see how hard I can work. All right. Anyway, yeah, we're having problems with the stream. Yeah, the internet. Wow, Scott has quite the story. That hurt. Okay, it's the stream is flashing on and off things. I don't know what it's doing or why. All right, Warren, things to do with the paperwork I talked about earlier. Mercury 3, good afternoon. Mercury, I'm just wrapping up this live stream, so I'm going to say goodbye to you as I say hello. All right, here's what I'm going to do now. I'm going off the camera. You gentlemen, ladies, you say goodbye to each other. I've been talking now for 2 hours, 3 hours. I'm done. I used to do my 4-hour live stream. This is actually the first day that I have cleared up since I got back from New York. Hello, bye-bye, John Boone Bean. This is the first day since I got back from New York on the 3rd of May. This is 5 days now. For 4 days, I never stopped. Yesterday, we got up, went to the city. We get back from the city we got up at 5:30 in the morning, and we got back from the city about 3 o'clock in the afternoon, and then I had stuff to do. So this is the first day I had off. So thanks for stopping by. Mercury, as soon as I get my Skype back up, everybody else, I'm going to be calling you guys. I'll get your shirts out from the Philippines. I didn't. Mercury, let me just tell you a quick story, Mercury, while you're here. I wanted to get your shirts out the day I left New York to come to the Philippines. On what was that? April 30th is when I left. Had I stopped at the post office, it would have taken 15 or 20 minutes. I would have not gotten on the plane to get to the Philippines. When I left, plane said it was going to take off. I thought it was a 4 o'clock registration, but I said, let me go there a couple of hours early to the register for the plane. Well, at 2:15, I called the cab. At 2:17, the cab was there. I was in the cab by 2:22, and he took off with no traffic, and we went to the airport, which took about 8 minutes, 10 minutes. So I was there by 2:42, and I got a hand truck, and I went to the counter, and I said to the girl, I saw there was a couple of people there, and I readjusted the weights in my bags right there. They have the scale there, and I readjusted the weights so everything would be under 23 kilos, because I had one was 22 kilos, one was 20 kilos, and one was 13 kilos. So one box didn't have to be readjusted. So anyway, I said to the girl, I'm glad I came early. She goes, early. She goes, in 11 minutes, it was the cutoff time to sign up into the plane. You were gone. You were not getting on this plane. So had I stopped to mail your shirts, Mercury, I would still be in New York right now. Because I said to her, well, when would be the next flight I could have bought a ticket for? And she says, in a few days, maybe, but nothing within that time frame. So I would have paid for hotels for people to come here to visit me on the 5th and the 6th, which I did pay in advance, or lost that money. It would have been a mess. So I'll be shipping your shirts from the Philippines. I'll also be shipping Scott's shirts with your shirts with an address label and money for your shirts, for Scott's shirts label. Should be like $12 US. So I'm going to be either shipping your shirts to Scott or Scott's shirts to you. And then you guys will I'll send some cash and the shirts to cover the shipping, but I'll make out the labels first. And also, there's another, shitting shirt. I thought the check-in time was, well, it was 2:45 when I got to the counter, and I had 11 minutes, she said. So 2:52, 2:50, 3 o'clock was the check-in time. I guess she might have made a mistake, or maybe it was 3:50, 2:57. But I thought the check-in time was 4 o'clock. She told me the plane leaves at 4 o'clock, and it left at 4 o'clock too. I went through. I got to tell you, I will never fly China Eastern Airlines again. Never, ever. I'm going to do a live stream against China Eastern Airlines. I hope no one ever flies that airline. I hope they go out of business. Not only do they suck, not only did they go through everything I had except one box. They went through everything. I showed in my other live stream. They put wrappers on. This suitcase was inspected by. Here's the paper here. They went through everything. They went through my luggage. Notice of baggage inspection. To protect you and your fellow passengers, the Transportation Security Administration, TSA, is required by law to inspect all baggage. As a part of this process, some bags are opened, blah, blah, blah. Some are not, blah, blah, blah. We opened up your bags, and we put stickers on the bags we opened up. And those were the 5 drives. They did open up that box. They went through everything in the box. There was some expensive shit in the box besides the drives being worked almost, well, at the time, I think I paid $240 a piece for the 3 terabyte drives. So $1,500 worth of drives. But they thought that was some sort of an explosive device, the drives, because I had them stacked one on top of each other. So, and then I had wires from a drop light I had in there. So I had the drop light wires on top of the 5 drives. It probably looked like wires into a metal box full of stuff they couldn't see. But anyway, I don't think they took anything. But I did lose my good belt because not only did they inspect my suitcases and my other 2 boxes, but the guy took my camera bag. He wanted to take it apart. I'm going, what are you doing? Just put it through the... Don't touch it. Don't be pulling the camera bag apart like that. There's little pieces from my GoPro camera in little doors and little wires and stuff like that. And he's going, don't touch it. And I'm going, don't talk to me like that. That bag has a lot of money in the bag. Don't be pulling that shit apart like it's like tools or anything like that. Those are little pieces for cameras. I had an extra door for the GoPro, the side door and the bottom door. I had an extra a special lens for the GoPro. Don't be pulling that shit apart like that, because he was pulling it apart, but he wasn't pulling it apart over a tray or over a special bin. He was just pulling it apart over like an assembly line. So be careful with that shit. It's expensive. He didn't want to hear it. This guy pissed me off so much that I forgot my belt. Or he took the belt and put it someplace else because he wanted it, but I don't know which one it was. But the belt that was originally in the box with the camera bag, now he pulled the inside guts of my camera bag apart and put it in 2 separate boxes that were not part of the first box. So the belt might have been in the 3rd box, and the plane was getting ready to take off in like 12 minutes. He had me there for 15 minutes taking the shit out of each pocket in my camera box. He took out well, I'm not going to tell you what was in the different pockets, but he wanted to see what was in the different pockets. And I'm going, what the x-ray machine shows you what it is. No, I want to see it. I'm going, what the fuck is wrong with you? What exactly is wrong with you? I didn't say that to him. I'm going, what's wrong with you, dude? You're taking this bag apart. There's nothing in the bag. I'm a photographer. He didn't want to hear it. He just wanted to break my balls. And he broke my balls, and I lost my good belt. And I'm not happy about that. All right, so I'm checking out this link. Some crazy shit, Scott. All right, gentlemen, I'm done. It is now a full 3 hours. So you guys say hello, goodbye to each other. I'm gonna go over there and I'm gonna prepare some foods for myself. Thank you for stopping by, everybody. Thanks for the comments. Thanks for the information. Scott just put up a pretty good link on there if you want to see what's going on in New York City. Me personally, I didn't have one problem while I was in New York, but I was moving around heavy. And when you're usually moving around heavy, people usually understand that you're not the guy they want to bother. Holy macaroni daisies. Do you see this? Big, yeah? Holy macaroni. I guess it's that root beer, yeah?
Oh, yeah. You like that?
I guess.
No makahilo?
No, I guess not. I guess it's good sugar. There was a pile of ants on my. I had a cup with a little bit of root beer in it. They were piled on that. There was an ant hill on my cup. You want pizza, honey?
No, thanks. That's all yours.
All?
Yeah.
Okay. I think I'm gonna have those pants.
Do you want to go there or she wants to go here?
No, I want to go there.
Okay.
I have other stuff to do there also.
Okay. Well, look.
I don't want the lawyer. I don't like that lawyer at all.
Yeah.
Yeah, he's not checking nothing between me and her. Forget that guy.
Okay.
He's not part of anything. He had a contract I wanted to. It's total garbage, his contract. This is just between me and her. Have nothing to do with his lawyer son. Bye-bye, Scott. All right, everybody. Yeah. It's a Christmas tree. This way, you know how you put a Christmas tree away and then before you know it, it's Christmas again? I don't worry about that shit. I know where it is. And you can't find it. It's got dust all over it. Now we know where to... Anyway, ladies and gentlemen, thanks for stopping by. Daisy, say goodbye.
Bye-bye, everyone. Thanks for watching.
Okay. Everybody, God day to everybody from Michael Fazio and...
Daisy May.
In the Philippines, baby. Umping per me. Bye-bye, Dennis. Bye-bye, B-Bots. Bye-bye, Mercury. Bye-bye, Warren. Bye-bye, Scott. Umping.